I'm going to take my virtual gavel and call this meeting to order. It's the Board of Supervisors for February 9th, 2021. And could we please have the roll call?
Supervisor Levere.
Here.
Supervisor Long.
Here.
Supervisor Huber.
Here.
Supervisor Ramirez.
Yes, I'm here.
Chair Parks.
Yes, here. And with that, could you please join me for the Pledge of Allegiance? I pledge
allegiance to the flag
of the
United States of America
and to
the republic
for which
it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. And could we please have a motion for the minutes of our meeting of February 2nd?
Huber, so moved. Approval.
Second.
We have a motion from Supervisor Huber and a second from Supervisor Ramirez. Could we please have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. And at this time, we're on to agenda item number 5, which is our agenda review. And I'll call on Mr. Mike Powers.
Good morning, Chair Parks, board members. Item 8, receive a report on the novel coronavirus. Comment letters from Judy Bruce, Lorena Sadawatari, and Robert Munoz Atkinson have been submitted. Item 32, CEO's Office, approval of the final terms of the county's second business assistance program. A board letter and Exhibit 1 have been submitted, and requests to be heard after the COVID presentation. Item 32. Item 38, Resource Management Agency, receive and file a report back regarding allowing retail sales of medicinal and recreational cannabis in Nyland Acres. A PowerPoint has been submitted. Item 39, Resource Management Agency, public hearing to receive a presentation of the County of Ventura draft housing element. 9 comment letters and a staff PowerPoints in Spanish and English have been submitted. And finally, item 45, closed session, existing litigation, County of Ventura et al. v. Mrs. Olson's Coffee Hut et al. A comment letter from Susan Marfleet has been submitted. And that's it. Thank you.
Thank you. And do we have a motion to adopt the agenda as revised?
So moved.
And we have a motion from Supervisor Levere.
Huber, second.
And a second from Supervisor Huber. Could we please have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you very much. We are now going to go to our moment of inspiration, and we're pleased and delighted to highlight businesses participating in the Great Plates program that supports older adults at high risk from COVID. And it allows them to stay at home and stay healthy with nutritious meals delivered to them 3 times a day. The program also provides a vital economic stimulus to our local businesses and the workers struggling to stay afloat during the pandemic. And so I am delighted to have here for us this morning the owner of Mouthful Eatery in Thousand Oaks, Luis Sanchez, and also Orestes Simos with the Waterside in Oxnard and Water's Edge in Ventura. And they're going to tell us about their involvement in the Great Plates program. And Mr. Sanchez, would you like to go first?
Sure, absolutely. I guess good morning, everyone, and thank you for the opportunity to allow us to share our point of view on how much this has helped us. Basically, when the governor spoke of the Great Plates program, it was probably the lowest point in my restaurant. We were down to 3 employees, and I felt like he was talking to me personally. So I just got up and started doing everything that I could do at that point on gathering information. And here we are doing it after, almost a year, and we couldn't be more thankful. It saved my business and allowed me to rehire, and we're almost at 100% with the number of employees that we had. And not only did it help financially, but it's something that I didn't really think of at first, is how rewarding it is, and how my clients, the people that I deliver food to, just how fulfilled and sort of happy they are to have that human connection of the driver going there, or calling me and making adjustments on their menus. And every time you get them on the phone, it's like they just want to share something, whether that the eggplant parmesan that we gave them was awesome and it reminded them of a family gathering, or when I have a customer that he's 87 years old, and I thought that I was speaking to my customer, but it actually was he takes care of his disabled son, and he still works at a golf course. And it's just amazing to me that that was just so touching, that you would think that at 87 somebody will be looking after you, but he's still looking after somebody. The wife has been long gone, and he still has a part-time job at a golf course, and he was just full of life on the phone and so excited to tell me about his life. So sometimes it's not just the food, but the human connection that a lot of people are in need of out there. So that was a very rewarding on my end.
Thank you, Mr. Sanchez. And these individuals are very fortunate to have tasty food too. And how nice that we do have that extra human connection, as well as helping your business to keep going. It is a tough time.
Right.
And Mr. Simos, did you want to go ahead and let us hear from you?
Good morning, Madam Chair, and members of the board, and thank you very much for having us to express our gratitude for such a great program. There are a lot of sentiments that I would share with Luis, well, for the experience that we've had. And back in March, we were hit with this pandemic, and I'm the director of operations of a small group, a hospitality group. The restaurants, as you mentioned, Waterside and Water's Edge. We didn't know how to handle it. There is no playbook for this before. There is no guidance how to deal with such a crisis. But we were able, with the team that we had of managers and chefs and all the members of our family, the employees that we have, we were able to get together. We started on our own to try and feed wherever we could, provide assistance. And along the way, about 2 months later on, we were able to join on the Great Place program, which was a lifeline, undescribable lifeline. It has been, it is. We have been able to hold on to about 50 or 60% of our staff since then. With the Great Place program, we have been able to continue our own personal work of providing free meals to various nonprofit organizations. We have actually reached, for 2020, I believe it is past 40,000 meals that we're able to serve on our own. And we wouldn't have been able to do that without the Great Place program. A big thank you to Victoria Jump, the director of the VC AAA, and to Monique as well. Without their help and their team from VC AAA, I don't know how this would have been possible. We're very thankful. We have our neighbors here that we take care of in our community. We get calls on a weekly basis from relatives of theirs from out of state, from other cities that they're not able to visit. And they just so appreciate that there is some human contact on a daily or weekly basis. We try to get calls out to them to see if they need anything. And it's amazing. It's so unbiased. It is a program that does not look at anything, just how to take care of fellow humans. And we're very, very blessed to be part of it. Programs like this, such as even the World Kitchen, Mark Valdivia and his wife, Nicole, have also done a great job there, which is a similar program. We really hope that we get to see programs like this more often. We're blessed to have staff that have put in endless hours, volunteers from our executive chef, Alex Montoya, to various managers of our group. They just want to give, and it's really amazing. So thank you very much, Madam Chair, for supporting this program, and we hope that we get to see for everybody better days for that to come. Thank you.
Thank you so much, Mr. Simo, with Waterside and Oxnard and Water's Edge in Ventura, and then also Mr. Sanchez with Mouthful Eatery. We are so appreciative of the public-private partnership that's out there helping our vulnerable citizens. Just a great program. And I'm so delighted that you, as well as other restaurants throughout the region, have been able to partner with us on this great program. Thank you this morning for the inspiration. I know some supervisors do want to comment. Supervisor Ramirez.
Thank you and good morning. And I want to really appreciate these gentlemen for coming forward and talking about their program. I know there are many other restaurants who are also engaged in this, particularly I know of restaurants in Oxnard. And I always said when this program began, we should have been doing this before the pandemic, taking care of our elders. That's one of the cruelest things about this pandemic is the sort of attitude, well, you're older and you've had your time in the sun and, you know, we don't really need to pay attention. So I really, really appreciate it. And I would like to ask people to really patronize these restaurants. I've been to both of the Watersides, and the one in Oxnard and Ventura. It's wonderful. I'm sure they have at some point ability for us to go back. I've enjoyed them when we could go in person, and then at some point curbside or delivery for the other restaurants. Have really encouraged people to patronize our restaurants that are complying with the health orders, providing what is really almost love, and that is nutritious food for people in need. Thank you very much.
I like that comment, providing love too. And also I did want to additionally highlight AAA, that's our area agency on aging, who's helping to set this all up, and an amazing amount of sudden work that they had, and really it has come together. We're really thankful to the state too. And I see that Supervisor Long also would like to comment.
Yes, I just want to reiterate, I completely agree with both of you, Supervisor Parks and Supervisor Ramirez. The importance of a warm meal to our seniors, especially in this time, is just crucial. And dropping off meals with the AAA program, it's a great volunteer program to really talk to our seniors quickly as we drop off food and just say hello and some cheer. But their value of this food is so important. It's harder these days to go out, and they don't want to go out because they don't want to get COVID. So cooking a meal for them is just such a great gift, and really appreciate the connection from the federal, state, and local level to provide food for our community that's most vulnerable. So thank you.
Thank you. And Supervisor Levere, you also wanted to comment?
Yeah, thank you, Madam Chair. You know, we've talked about this in the past, how this situation in this program is just such a win-win. The fact that we're providing fresh, nutritious meals to our seniors and other homebound individuals, but also keeping our restaurants alive and enabling them to rehire staffs and keep people employed in the county. It's just been such a win-win. I want to thank Victoria Chump and the entire team at BC AAA. They've done such an amazing job administering this program. And I also just want to say, you know, this is a program that this county board has gotten behind. You know, after CARES Act funding went away, I know many jurisdictions across the state dropped the program, but we made the commitment to keep it going because we wanted to do the match. We put our general fund dollars towards this program because we saw that importance. And it's something that I hope we can continue to do both for our seniors and our local businesses. So thank you, Madam Chair.
Thank you. Supervisor Hubert, did you want to comment?
Yes, thank you. I just want to say hearty congratulations to our staff for a great job on doing a really good job on this program. I really well deserved.
Thank you. And thank you to our businesses. Thank you so much for speaking. I think we're up to almost 2 million meals that have been delivered. It's just astounding. Couldn't have done it without you. Thank you so much. Appreciate you being here. We'll move on now to our next item on the agenda. And this is the consent agenda items 12 through 30.
I'll motion to approve.
Huber, second.
Okay, we have a motion and a second. Could we please have the roll call?
Supervisor Levere,
Yes.
Supervisor Long,
Yes.
Supervisor Huber,
Yes.
Supervisor Ramirez,
Yes.
Chair Parks.
Yes, thank you. That motion passes unanimously. And thank you to the staff that put in all the work for those items. Good to see it moving forward. And now we're going to move on to our coronavirus update. And I know we have some good news for our community and our government. So I'd like to go ahead at this time and pass it on to back to our CEO, Mr. Mike Powers.
Thank you, Chair Parks, board members, and community members. Yes, so a lot of positive news. Just to start off with our numbers, we saw a big drop over the weekend in cases from to 1139 out of over 20,000 tested. And it's not an official trend yet, but that's about 5.6% positivity rate. So a tremendous improvement. And what that shows is what we've talked about. The numbers can rise very steeply, but they can also fall just as rapidly. And that's what we're seeing. And what that means is that the community and our businesses continue to comply with guidance, and they continue to get tested at some of the highest rates in the state. At the same time, administering vaccines is our number one priority. We know it's your board's number one priority and our communities. So despite the shortage of supply, we are going to announce some expansions today, both in terms of who is eligible and capacity. And so with that, why don't we just go ahead and get right to it? And we will go to Mr. Zimmerman.
Okay, wait, we need to share that screen.
And yes, go ahead.
We're going to do some musical chairs.
Yes, we are.
And I know while we're waiting, if you would like to see a lot of this presentation and some updated information, we will also be having a press conference tomorrow at 1 p.m. And you can go to VenturaCountyRecovers.org and get information and watch the press conference too. It's really more of a briefing. And I know that we cover a heck of a lot today. We'll have a lot of information today, but there is also the availability of more information tomorrow at these press briefings that we have on Wednesdays at 1 p.m. It's also at VenturaCountyRecovers.org that you can look up and sign up for updates on when vaccinations are available to you. And also, if they are available, if you are in that phase, that tier, you can go ahead and sign up online. There's also a phone number that you can go to sign up for vaccinations also.
I can start verbally.
Why don't we go ahead, Barry? Yes, please. That would be great. Thank you.
Okay. No worries. When the presentation will go up, I'll just highlight those things. But first of all, I'll give you an overview of where we are on our total effort right now, volume and activity. As of the February 8th, that would be the morning of the February 8th, our numbers are we vaccinated 98,851 vaccines have been issued. That is a very high and good volume. Of that, 19,183 have been second dose appointments. So the highlight we wanted to make is that our first dose allotments do go out quickly. We're well in the upper 90 to 99% of our first dose vaccines we receive go out and are made in appointments and for that week. So our volume's high. We do have a little shift occurring right now that we have second dose requirements to get the second dose in. So no different than that we've heard other counties now are shifting some of the clinics over to second dose appointments only, which we have done. And the fairgrounds will be second dose appointments for both Pfizer and Moderna. The other sites will be operating on a 50-50 schedule to work these in. So now the state no longer is allocating based on first dose, second dose strategy. It's going to be giving us an allotment of vaccines, and we will manage the appointments based on the need, both second dose and first dose. We anticipate that we will work through this bubble of second dose in the next 2 to 2.5, 3 weeks. And when we do, we anticipate the final week of February, we will be at an even pace of first dose, second dose. So all our locations will be able to administer first dose, second dose simultaneously, as well as scheduling appointments, first dose and second dose, that people will be able to schedule those at the time of their first dose, which will even out the whole system. I just wanted to make you know that the volume that we are doing, 98,000, is a lot. It is, we did get a report from the state to understand where we are. We are 12th in the state as far as volume goes. So we are producing a lot of vaccines currently. I'll just move on that of the total vaccines that we've administered at this point in time, 29,687 of them have been for seniors above 75 years old. To give you perspective, we estimate, I can share my screen if they'll allow me, and I can put it up, but so of the 98,000 vaccines, we've had 29,000, roughly 75-year-olds come through and receive their first vaccine. That is an excellent volume out of our estimated population, about 56,000. We've covered over 50%, almost 53% of all eligible individuals of 75 and older have received a vaccine at this point. We know many will not, some will choose not to receive it. So we're measuring that against the total eligible population, which is excellent. So if you could go to slide 5, that would work. And
Barry, I apologize. I'm getting some texts and so forth that they wanted to see some of the information on the screen. Is there a way, I know you're on, can you start just to real quick go from the first slide just so they can see it?
Back.
Yeah. Yes. I just think this information is so key. I hope you don't mind, Madam Chair. I just think this is really important.
So this is our dashboard here showing the total volume of vaccines issued in the county. This is for all issuers of vaccines at this point, 98,851, which I indicated is about volume-wise, we're 12th in the state, which puts us in an excellent standing of getting vaccines out. You can see first dose, second dose, and we have appointments scheduled out for all the vaccines we have. This dashboard will be updated since we are no longer going to be tracking first dose, second dose. We'll be tracking demand and volume at that, the way it's moving forward. And so that we are working on a new dashboard that will come forward later this week. Next slide. This just shows the activity that has occurred throughout the months. Obviously, we started in December. We went up very high in January. And what you'll see in February, a larger growth in the second dose column or aspect of that graphic. So we'll start seeing second dose and first dose equalize out is what we want in order for our system to address people timely on their second dose. We do have a wave of second dose appointments coming, and it's a big bubble. So to get them in, that's where we've talked about that we will get appointments available, but it might be within 2 weeks of your eligibility date for the second dose. That is okay. I encourage people not to panic about that. We are aware of that, and we'll try to get you your second dose as soon as possible and still have it be effective. Next slide, please. This is the slide I was referring to on age that we've done. We should see that under 65 is the largest group so far. We will count most of that with the healthcare industry that was serviced in order to get them. They were first priority, and now we're moving in to a senior priority at this point. I think we're finishing up pretty much with the first and second dose volume with the healthcare industry. There are some still left in that. I'm not ignoring that there are others that are doing, but the majority have been done at this point in time. 29,000 75-year-old individuals have been vaccinated. That's nearly 53% of the total estimated volume or population for 75-year-old seniors and older. That is an excellent penetration at this point. I did speak to a network provider yesterday who's related to a multi-county entity, said they reached out to all their 75-year-olds and above and said the majority of them had already received their vaccines from the county, and they had no request for appointments. And so they were saying that they feel everyone had an access, at least in their system, to get the vaccine, and they were ready to move on. So that was encouraging to hear us. So this is our current and proposed phase for eligibility for the vaccines now. So we've had healthcare, we're majorly done with that. Seniors are very good, 75 and older penetration at this rate. So we feel it appropriate now to open up to seniors 65 to 74 at this time. I just want to emphasize that our vaccines are at the same level, just that we're working through the populations, and we feel now the limited appointments that we have, we're opening it up to a larger population. This group of 65 to 74-year-olds is estimated to be just over 80,000 individuals. So it is basically almost nearly the combined two first groups that we had is in this group that we're now opening up to. That being said, we will make as many appointments as available, but recognizing that there'll be limits to access, and some might be frustrated, but we'll work with them to get appointments as soon as we can. This is kind of the schedule. Effective today, 65-year-olds and older will be eligible. That has been a good strategy. We know that the highest risk population that we saw, the greatest percentage of death rate per within COVID, as well as the highest percentage of positivity and death rate were in the 75 and older. We've worked through that and made a good mark in that. We also recognize that 65-year-olds is at risk, and so we are opening that as of now. We are also, we have been only opening a week at a time appointments. We feel we understand the pace and volume of vaccines that we're receiving, that we can estimate out more accurately the sites and potential appointments. So we are going to open up not just this week, but next week's appointments as well. And those links will be up tomorrow, this coming Wednesday, to allow more access to appointments that people can schedule in advance. We are also transitioning to a My Turn appointment system. This is also a state-run system. The current one we're on is the state system, but this is the one the state wants us to uniformly work on. We hope to have that up in the next week or so, in which we'll be starting to then make future appointments out by clinic, by location on My Turn app. We will make that very apparent on our portal, as well as make that public when those happen. We anticipate on scheduling out based on My Turn, getting that up the remainder of February, as well as opening up scheduled appointments at our locations through the month of March. In addition, there'll be a phone system with that our phone system will be running at that. The state also has a phone system attached, phone registration system to My Turn. We are assessing that, whether that can meet our needs at this point. Thank you. Next slide. So I just wanted to give you context of what our system produces and what is the demand right now at this rate. So our eligible population as of today would be the healthcare industry. Seniors 75 and older was a previous group we targeted. Now it's 65 and older. That current phase has about 181,000 individuals in it by census estimates. We've administered first dose about 80,000, so we have about a balance rounded 100,000 potential individuals in this current phase to get their first shot. If you look at it below, now that we're combining first and second appointments and dosing working together, we will have to deal with nearly 200,000 doses for this population in order to get them through. If we only receive an allocation of roughly 10,000 a week, that gives you the idea. It's a 22-week cycle just for this segment of the population. So I wanted to just give that context, not to diminish any hope, but to understand that why there's limitations on appointments and so forth is just the sheer volume of vaccines and the ability to administer those right now there. We anticipate that later this month, that we hope in March, there's a discussion that the federal government will be able to increase through the manufacturers vaccines to the state at a greater level. We would anticipate that will roll down to us, and we will be able to now expand greater than our allotment that we get weekly at this point. So we hope that's coming in the near future. We also understand that the state's third-party administrator will have a role in distributing vaccines to different provider networks. They are still working that. We have not been fully apprised on that strategy at this point, but hope that no impact will be, at least on our allotments that come in and who we are targeted to serve. This just gives you an idea of our site capacity at this time. We have the current locations operating: South Oxnard, the Ventura Fairgrounds, Thousand Oaks, a first responder site, and 15 pharmacies. That gives us on a max about 4,000 daily volume there. We're nowhere near that capacity. We do run those sites at a lower level because it's basically supply of vaccine. I wanted to make you aware, though, that we are working to expand the distribution capacity in anticipation of more vaccines, as well as managing both first and second dose volumes in the system. We are opening up a site at the Rose Avenue in Oxnard that will be opened this week on February 11th to get it started with a few appointments and training staff that will be fully operational the 15th with a full schedule at that site, which should at full capacity run about 1,000 individuals a day there. That's the Babies R Us location off Rose, if you know where that is. The the week after the 15th, starting February 16th, we'll be setting up the Camarillo Ventura County Office of Education Conference Center as a site. And that is anticipated to also start scheduling and receiving people about February 18th at that rate. We anticipate then also a Santa Paula major site to be up and functional the week of March 1st. I did want to highlight a few other things that are actually currently happening. We do have mobile teams that we've been building out to go out and to work in a mobile environment. So far, we have 4 teams set up. Each team is a membership of 4 individuals, and they can go to specific locations and issue vaccines. Right now, they are doing long-term care facilities that did not qualify for the federal program, and other environments where they can go and meet with a group of individuals that are qualified to receive the vaccine. We hope to grow that team from a 4 mobile team environment to a 10 mobile team environment, as well as incorporating not only long-term care, but also homebound individuals. And we are working with AAA as well as the Human Services Agency and others to identify best how to schedule and work those individuals into those mobile team environments. In addition to that, these mobile teams are working on a farm worker field clinic pilot. And it says on February 15th, but we're actually have 2 small farms that we are starting on the 11th, in which we will be going out to those farms, working with the workers to understand how to register them, as well as how to administer the vaccine in that environment. And those 2 farms are, one is in Fillmore and one is in Santa Paula. It is truly a pilot to best understand how we can service a remote environment. It won't be the scalable solution for all farm workers, but it will be ones in particular with those small farms that may not have the resources to aggregate in one large volume site. So that's it for that. Next slide, please. We are also.
I'm sorry.
Go ahead.
I did just want to chime in that additional networks we're partnering with are the clinic systems like Clinicas and Community Memorial and others. They'll be an important part of our overall vaccine administration strategy, but also in particular in terms of our equity priority and your board's equity priority, focusing on low-income communities as well.
Yep, that's correct. Thank you, Mike, for that.
Yep.
All right, next slide just gives you an overview of the requirements and the waiting periods. Next slide.
I'm doing it.
It's just a word slide, and it goes over the requirements for the minimum wait period for those getting the first dose. I wanted to make that known to individuals. It's 21 days, no sooner than 21 days, and for Pfizer, and no sooner than 28 days for Moderna. Those that are eligible based on that criteria should receive an email a week or so before that 21st or 28th day, indicating that your date of eligibility will be coming up. With that, there'll be links associated with the second dose appointments that you can schedule. I know that the scheduling system is not the most ideal. It's cumbersome. We recognize that. We don't really have a ability to change that at this point in time, but as we go towards my turn and the unified application, we hope that process will become simpler, where you don't have to click on each day and register to find out if there's appointments available. If you receive a link for your second appointment and you go through those links and there's no appointments available, as we open up additional ones, you will receive another email with additional links for appointments. Our effort is to review the data and to communicate to those so they can get an appointment within that 2-week window is what we're hoping for there. So it's 6 weeks after your initial shot is the window we are trying to do. So that would be a 2-week window for Moderna and a 3-week window for Pfizer. So that's how that is working to date, and we'll try to improve that. It is not unique to us, the cumbersomeness of the system, but we're trying to make that as simple as possible for us. We hope when we get to the end of February and March that we will be able to not only schedule your first appointment, but also have second appointments scheduled and available at that time to alleviate some of this conflict that we have with the current system. For those that are seeking who want to know where they can acquire availability of vaccines, they're posted on our website under the vaccination area. It's VenturaCountyRecovers.com or .org works on that. Those who have language needs for language assistance or do not have internet access can call our phone line between business hours, Monday through Friday, and it's 805-477-7161. If those that call the system, if there are no appointments available, a message will come up and say there is no appointments available at this time. And so you don't have to wait to get an agent per se to find out if there's availability. We will put up a notice saying that we're all full. If someone wants to continue on to speak to someone, they can also go through the menu to speak to someone as well. But we will make that notice up front in the call system so you're aware if appointment availability is there. I think that summarizes about everything I could cover in a quick little time.
Thank you, Barry. Maybe we'll pause here for any questions from the board members.
I also thank you so much. A lot of good information there. But I think what everyone heard was 65 and now up is the new tier that we are taking appointments for, and that is huge. And I also want to thank people in that age range for their patience, because we did start with 75 and up, and we realized that population, the 75 and up, are the most vulnerable, most likely, if they're going to die, it's going to be in that age group. I think something like 2/3, 73% of individuals who have died have been in that 75 and up age range. But I am absolutely delighted that we are now opening that to 65 and up. And I know that all of us on the Board of Supervisors is glad to hear that we are able to do that, and also doing it in a way where we really prioritize those who are most vulnerable. I know we have some supervisors who would like to comment, and we'll go to Supervisor Long.
Thank you, Barry, for the overview on the vaccines at 6. Ooh, yeah, I'm off mute. Just checking the Zoom thing's all fun. I really want to say thank you, Dr. Levin, and the team that is working on our vaccines. It's been since January 12th that the CDC announced that they wanted to push nationally vaccines for 65 and older and with comorbidities. I appreciate the slide in which you showed that we have over half of our seniors 75 and older are now vaccinated, and that we can lift the age to 65 and older. The community that is outreach to me, I appreciate, and we've heard you. Thank you for holding tight, because we needed to get these in, but we also need the source. And so I keep driving, even though we do open this up to 65 and older, and we have extended our appointments. Thank you for that. We will still have a lot of people that we can't serve until we get more vaccines. And so I wanted to ask on the My Turn, Barry, when people go to that and register, who are they registering with? Is it just county? Is it third party? We know we've heard that there's federal agencies are able to give vaccines and so forth. So do we know when they register for My Turn, where would they go? Just to clarify.
Yeah, so right now, my understanding is My Turn, it will be, they'll be registering with our system that the local health department is managing right now. That may change in the future with the third-party administrator, but if you go even to My Turn right now, there'll be a link to our current prep mod system. So that's the way it works right now. Until we get onboarded with My Turn, then we will convert over to their native application, and the scheduling will be on that application. It will be for registered clinics that we have that we are working with in the county. So the ones that I showed you there, for example, the Fairgrounds, Thousand Oaks, and so forth, will all be open, and they'll show their availability of appointments.
Okay, and so also to clarify, on the other locations in which you can get vaccines from Rite Aid, Vons, anywhere for the private sector. They can now go to the 65 and older as well because of our county rules and regulations. Is that correct?
Yes, that's correct. So all the other participating entities that are under our jurisdiction should follow our policies. So it should be 65 and older. I do know there are some federal programs that are targeted, let's say with the VA and the veterans, and so they may have a few different criterias because they're targeting a special group. And so, but the majority of those that are offering vaccines should be 65 and older, and the previous populations that we have already opened, healthcare industry, that type of thing. The pharmacies are a little bit unique in the sense that we do supply the partnering pharmacies with vaccines, that we do link them, but their registration system is within their own pharmacy network. We link them to that, but that's how they manage their appointments.
Okay, and thank you for that. It's good for our community to understand. It's not, we're trying to work as a team here, and there's many ways in which vaccines can get out. And so I want to make sure that people know that that is an option for them to call their Dignity Health, go to the Rite Aid, and still it's going to be 65 and older. I'm getting texts already of how relieved people are for that opportunity. So thank you. Also, on the mobile teams, I'm very interested in that. I appreciate all the going back and forth with our city council members. One area is Leisure Village in my district, a very centralized location for seniors wanting to get vaccines, and how easy it is. You go to the clubhouse and like a blood drive, just go and get your vaccine. And so I really would support that. The logistics, I won't dive into the micromanagement of that, but good luck in making it aligned with the reservations and one sites and so forth. Any help from my staff and I, please let me know.
Sure, and that would be considered a mobile community site. I'll tell you, the mobile teams right now we're trying to finish up through the licensed long-term care facilities first before we become a community like mobile clinic activity.
Okay, and then I have a ton of ag, and I'm sure my farmers and farm workers are saying, okay, me first. And how do we reach those farms like Ryder for like Mission, or partnering with those companies to service them as well?
There is a committee that's working with the ag industry right now, so that's communication going on with them. This is, I'll tell you, this is a pilot to understand what needs we are. So it is truly a pilot, not just the vehicle for working in that industry. It is truly a pilot. We have small farms. We have over, probably more today, but 25 farms that said they would like to work with us to see how we can work in the field environment. So that's really our pilot environment. Once we understand that, which will be about a week or two working in that, then we can say, okay, how do we take this to scale, and what does that mean? We have not necessarily opened up the essential workers at this point in time. So this is truly just a unique pilot to prepare us for that time when we get more vaccines.
Thank you. And I'm always asking because it's okay. So let's plan, let's vision to where we're going. We have articles that have stated that certain colleges are now getting a vaccine for their site and their teachers and their students. And for the communities, for knowledge, is Cal State University Channel Islands doing that? Do we have any information on that, or any school districts like Oxnard Union High School, or any of those other districts? Do we know any information on that from the state level?
Yeah, I do not have specific on the school system, how that is, if that's a separate strategy or not. I do know that teachers and the education community is part of what they categorize as essential workers, which would be next in our priority listing. I do not know if there's going to be exceptions. We have heard things, and this is where I want to caution, just because you hear a snippet on the news doesn't necessarily mean the strategy is rolling forward everywhere under that. So, for example, I believe it was Long Beach State said that they were vaccinating students and teachers. Well, it turned out that they received 1,700 vaccines from the Los Angeles County Health Department. I don't know if that was a pilot or an ongoing basis, but it was a limited number there. So I would not say that they're going to be a comprehensive site or strategy on that. So more to come. We try to communicate at best. We're not holding back information. As soon as we know where we can go and how we can get vaccines out, we'll let you know.
Thank you. And on the calls for the state and federal I've been on, we're talking about super sites. And unfortunately, our county is urban, but we're not one of the counties that received a super site for vaccines. Los Angeles had, the governor just made an announcement that San Diego is getting one. Do we have any information for our community as to, are they able to go to those super sites in LA? I know we've told people don't drive to LA because there's so much COVID, but what are we telling our community on these super sites? Good.
Yeah, I don't know the specifics actually of the details for eligibility of those super sites. All I know is that they're federally run. They're not part of the subset of the state's allocation. So that shouldn't be taken away from us there. I have heard just indirectly that it's open to anyone in the state. I don't know how that works. Those volume sites are large, but it's set in a large urban area. What's being recognized here is that we do have the sites we set up are considered high volume sites as well. They're not as big as those ones that are on Dodger Stadium or as the federal government's doing, but they do have good capacity, and that's been our strategy thus far.
Thank you very much. I just think it's important, again, for our community to have the information about the super sites if it's able to go to. But the key thing for me, or my own biasness, is to make sure that our county is getting those vaccines from the state. So those super sites are vaccines over the top of the allocation that the state is getting. And so we are still pushing every day, and thank you to Rigo and Dr. Levin and Mr. Powers and everybody for trying to get more vaccines and showing them the true numbers of what vaccines we need.
I mean, what we're talking is the super sites can do a large number. They get a lot of press in it, but our system as set up today, we can do today without even our additional sites, 4,000 vaccines a day over 6 days. That's 24,000 doses a day or a week. And yet we only get around 10,000, maybe 12 on a good week of vaccines. So our system has the ability to do some high volume work, just that we're lacking the supply to come in. And as we open up, we'll be able then to juggle both first dose and second dose at the same time. So that's why we're expanding. You might say, well, why are you expanding when we have limited vaccines? Well, we're doing it in preparation so we can accommodate the total need, right?
If I may, Barry, if I may, I put this slide up to this point just to highlight that we're talking about, mass vaccination sites. Starting, roughly February 15th, when Rose comes online in the Camarillo site, we'll be able to do around 8,000 a day if we have the actual vaccines, which is pretty extensive in terms of volume and mass vaccination.
Yeah.
Well, I know I'm not pushing for a super site from my advocacy. I think what you're doing is tremendous to spread it out so that people don't have to drive everywhere and they can have it in their community and they can get the vaccines they need. I think that's crucial, and not bring tons of people together. I think it's important that we're doing this in a smart way. And so I appreciate everyone's efforts on this. I do. Thank you.
And we also have Supervisor Levere.
Thank you, Madam Chair. And thank you, Barry, for this update. I want to echo my colleagues' comments on opening up the vaccines to over 65. That's so important that we bring this group into the fold. And I'm really happy to get that update this morning. Several of my questions involve this new transition to my turn. Obviously, messaging is going to be key with that. And I was just curious, so if people went to my turn today, it's not up and running for registration. It's the 22nd when that's officially going to turn.
That's a target date right now. We've been trying to get in the queue to onboard with the My Turn team. And so we hope that into this week and by next week we'll be onboarded. And then we are estimating the reason the 22nd's there is kind of a demarcation that in our current system we're scheduling appointments out through the 22nd. So we're hoping that all appointments after the 22nd, there might be a few clinics that we can get up, like the Rose Avenue Clinic sooner, but the majority of the appointments after the 22nd, we hope will be on the My Turn app. So that's why that date's there.
So for the time being, people should still be using the county registration site.
Yes,
and phone number.
so they should still go to the county portal, which is on the county website that was referenced to get their appointments right now. I believe there is just maybe a link that links you back from My Turn. We've asked about that, so it's unclear. The push is to get on My Turn so we have a unified system. So that's what we're going for.
Great, thank you. And when do we anticipate the fairgrounds going to a second dose site?
It's this week.
And do we have any idea how long that's gonna stay in place?
Yeah, it will be in place at least for the next 2 to possibly 3 weeks. Will be a second dose. We had, as I indicated last week, I showed you the volume of second dose, that kind of a bubble that needed to get through, and that's what we're working through right now to do that. We're balancing out. We don't have, so we have Moderna scheduled out for 3 weeks for second dose appointments, Pfizer for 2 weeks because Pfizer has been a little bit more difficult to get the quantities we need to keep pace with that. So we're monitoring that as we can. So it'll be a second dose site for the next 2 to 3 weeks. We will probably bring up the Rose Clinic, and its first week of full operation will be second dose appointments to get them finished. Then they'll go to a 50-50 first dose, second dose strategy. The Thousand Oaks will be a first dose, second dose strategy after this week. And so hopefully by the end of February, all clinic sites will be first and second dose with a single vaccine there in order to just keep it flowing as the timetables permit.
Great. And Supervisor Long touched on this, but I know there's a big push to get our ag community vaccinated. And it's looking like, given the timetable, towards the end of March when we're going to be able to bring them largely into the fold. And I know that we're going to have ag community sites specific for them. Are we going to likely announce those startup dates as we get closer to the end of March?
Yeah, so on this meeting and on the weekly updates, you'll see the progression that we're making through this current phase. As I indicated, we're talking 200,000 doses for this current phase is what we need to get through, right? And so that will dictate how far down can we open up others. It's really a product of, do we get more vaccines and we can get through that 200,000 faster and open up to others. The only reason I put through the end of March is the best thing I can predict today, right? So things can change. We could get more vaccines in March and we'll open up more appointments in the month of March, right? But just because I can predict through the end of March doesn't necessarily mean April 1st we can go to essential workers, right? There's still some other variables that we need to monitor.
And I know we're fighting to get every single available dose. So there's a chance if we're successful there, some of these dates might be able to move up.
Absolutely.
Great. All right. Thank you, Madam Chair.
Thank you very much. And then any other supervisors? Okay, then
Yes, I do. I do have a question. Generally speaking, I have some concerns about the homebound seniors and even those now who are going to be eligible at age 65. And can someone address that? I've been contacted by primary physicians in the community, especially in Oxnard, who are wondering how that would work. Can someone address that?
Well, there's two things and some of it's still unknown from the state strategy on how they're going to incorporate in all the providers provider networks that are available. We've asked questions on that. We have not received a clear guidance there. So the provider networks will be important. And when I mean provider networks, that would be networks other than our clinic systems and clinicas out there, you know, your traditional medical groups and those type things should play a role in this. That is the strategy of the state. We're not clear on that. The other, but we do anticipate them having a role. And so they'll be able to capture patients that they have relationships with and work with them as well. The mobile teams I referred to is another strategy that we're looking at really for the homebound seniors at this rate. And so right now, we have a captured population that we know of, which is really our mission associated with IHSS, other homebound programs, disabled individuals, and so forth. We are scoping through that to see who are they, where are they, what is the magnitude, what is the circumstances, and trying to figure out a strategy how to effectively use these mobile teams in that environment. So that's what we're working on right now. With hopefully we'll be able to start to actualize as we build these teams up to reaching homebound seniors as well as the long-term care facilities.
I do want to recommend that we, and I know you're doing that and working on that, just really working with particularly our primary care physicians who would know, who can't get into the office. Nobody can get to the office now, but I think that's a good source of information.
I agree, and absolutely, Newport is the name of an individual, and there's others that we're aware of that should be leveraged, and so we're also waiting, and I think it will be a matter of a week or so. We'll understand the state strategy on how they're going to distribute to all these different provider networks and what roles they'll have. So that should be coming shortly.
Thank you.
Good question. Thank you. Back to you, Mr. Powers.
Thank you, Chair Parks and board members. And so the next area we would like to focus on is our equity efforts. We know they're a priority for your board and our community. So for that, I will turn it over to our community liaison, Rosa Gonzalez.
Good morning, board members, Chair Parks and CEO Powers, Rosa Gonzalez, community. Very excited to share today our community efforts. We'll start with our farm worker resource program, who is working with UFW to support COVID outreach at their food distribution events, which serve around 400 farm worker families a week. They continue to do outreach in Fillmore, Santa Paula, also with Cabrillo Economic Development and with community promotoras. They are also working with Red Cross on information and resources available to our farm worker community and have begun standing monthly meetings with Red Cross. They've also recorded PSAs and videos highlighting various programs and information, including the county's waiving of COVID-related office visits to county clinics, and also vaccine information, which is very important for our farm worker community right now, with a lot of questions that we're seeing and receiving about when they will be vaccinated, and also the safety of the vaccines. So they had created some great videos in Spanish, Mixteco, and Zapoteco, covering that the vaccines are safe, that they will require 2 shots, and also that the vaccines are free. And also, just to kind of add on to the pilot program that Mr. Zimmerman commented, our farm worker resource program will also be in attendance at each one of those pilot visits at farms, providing resource information and also helping answer questions. Since the launch of their Facebook page last week, they're seeing a great high level of engagement that they didn't have before on this, new platform, in which they're able to reach out to a larger audience. And they're also helping to meet the needs of our farm workers by providing the information that they need. They're also seeing an increase in calls to the office. They've seen their WhatsApp Spanish, Mixteco, and Zapoteco groups grow. In addition to that, our ag commissioners helping with the ag advisory update. We are working with ag industry and farm worker advocates to include a section on vaccines and also to include that growers are supporting vaccine efforts. Our healthcare agency is, in addition to the 5 high volume test sites that we have around the county, they also have 26 additional pop-ups scheduled throughout the month of February. This includes Mary Star of the Sea and Island Promise in Oxnard, Safe Passages in Conejo Elementary in Thousand Oaks, Fillmore Middle School, and also Sorzori Park in Ojai. Our Logrando Bienestar program with the county's behavioral health is providing mental health services to our Latinx and Indigenous residents. They're providing support for families on how to cope with the loss of a loved one that has passed due to COVID and also the stigma of being COVID positive. Additionally, they partnered with the Mexican consulate to share information for families needing information on how to make arrangements to bury a loved one in Mexico. This is helping ease stress on our families during a very difficult time. Additionally, county staff is meeting with various community partners and leaders, and we really want to take the time to thank them and acknowledge them for their time, their input, and their recommendations that has really helped us throughout this COVID pandemic with a lot of our outreach and meeting the needs of the community. We're also continuing with our calls with the South Oxnard and Santa Clara Valley community meetings, and also our agriculture farm worker community calls that we have every other Friday. And I'm also happy to answer any questions.
Thank you, Rosa.
Not seeing any questions at this time. Thank you very much, Ms. Gonzalez, for your report.
Thank you.
Thank you, Chair Parks, and thank you, Rosa. Yes, as Rosa said, and we continue to meet with community groups. This past week, we met with Plan and Clínicas del Camino Real. We can only do this through our community partnerships. So we will continue to do that, and we know that's a real priority for your board. Next up, I want to touch on just 2 things. Of course, schools is vitally important. The governor yesterday at his press conference mentioned that he'll be working with state legislatures and education administration for a safe schools for all plan for opening of public schools in California. Details will be coming soon, so we'll be waiting and monitoring that. In the meantime, just so you know, too, we are partnering closely, as always, with our Ventura County Office of Education and the new interim superintendent of education, Dr. Cesar Morales. We are also monitoring closely, as we've shared with your board and the community, the state's finalizing details on the third-party administrator. The governor announced yesterday that the plan is to finalize the contract with Blue Shield and Kaiser on February 15th with a projected launch at the beginning of March. And the purpose in that is to, of course, expand capacity and delivery and administration of the vaccine, and we applaud that. There are 2 concerns that we have raised with Chair Parks and your board with the state, and it relates to overall capacity and equity. And I'll start with equity piece first. As we just heard from Rosa, and as we mentioned earlier, counties, we believe, are best situated to provide access to testing and vaccines and services to our low-income communities and communities of color. And we have those relationships built already, and so we will be able to deliver, we think, more effectively. So we're raising those concerns with the state. They do seem to be hearing that, and we appreciate that very much. With respect to capacity, we have raised a concern that while in some counties this might be the model that provides the most access and volume, the most volume and capacity, in our county and some of the other counties, we do have a large capacity and ability to do mass vaccinations at a rapid rate, perhaps even faster than what they're talking about with their system with Blue Cross. As you heard Mr. Zimmerman talk about, we'll, in a week or so, we'll have the capacity to do up to 8,000 a day, 40,000 plus per week. And so we hope that whatever system they're working on will recognize that and continue to support and not sort of divert vaccines from our efforts in our county to ramp up the administration of the vaccine. So we continue to advocate on that, and we'll keep your board posted, of course.
Thank you very much, Mr. Powers. And who else do we have in your lineup?
Yes, next up, we are going to hear about testing update from Rigo Vargas.
Yeah, good morning. Sound check okay?
Yes, very good.
All right. Good morning, everyone. So yes, these are our current testing sites. You can see that we continue to provide excellent testing capacity, and we're both drive-up testing sites and our state-run OptumServe state sites. We're actually going to be having a fourth OptumServe state site. The last two, including this new one, are school-based, both for the community and for schools for when they especially open middle schools and high schools. And then, of course, our many of our ambulatory care clinics also provide this testing, including on Wednesdays. I believe it's at Fillmore, where there is no appointment needed. So all in all, our testing capacity is outstanding. We alternate. We have a friendly rivalry, if you will, friendly competition with San Luis Obispo as having the highest testing volume in the state. And so we continue to do very well there, and that does lead to a very good case rate adjustment that I'll cover in just a minute. Typical wait times are very good right now, less than 5 or 10 minutes, and results are usually back within 2 days, no more than 3. So please, I urge everyone that wants to get tested, needs to get tested, to do so. We have outstanding capacity. So getting to today's numbers, as usual, I have this placeholder slide from the previous days, not always knowing which numbers we are able to report by this time, given that we get these numbers from a state database that at times doesn't have the daily numbers, even preliminary for us in the morning. But I'm happy to report that, as Mr. Powers mentioned, the new cases was really good yesterday. That's the lowest for it seems a lot over 1,000, but it was the lowest that we've had since early November, that just over 1,100 cases. And then if you take into account the excellent testing volume that of new tests over the 3 days, so over 20,000, that positivity rate, as Mr. Powers indicated, is excellent. And so with that in mind, I do have the preliminary numbers for today, and we're going to be reporting 275 new cases. Tuesdays are one of our days where we do have the lowest numbers, but 275 just sounds so much better. It's still 275 people that obviously tested positive, but it's a lot less than these numbers that we've been reporting in the past. And then we're going to be reporting a little bit over 3,600, almost 3,700 newly tested Ventura County residents. Unfortunately, we are going to be reporting more deaths, and that's going to be 5 additional deaths today. As you'll see, I'm going to cover in the next slide after this one, three curves that kind of put the whole surge in perspective. But before I do that, today, as usual, the state around noon announces the new blueprint tier metrics, and happy to report that all of our metrics are improving in terms of the case rate. And the case rate is the state reports it. It's an adjusted case rate that again refers back to and is very much tied to testing volume. So some counties actually get their case rate adjusted upward. It increases if they have very low testing volume, recognizing that they're probably not catching all their cases. For us, we get the opposite effect, since we are usually on top among all counties with testing volume, and most of the time we get a very favorable adjustment. And again, the reason why I always mention the adjustment factor is because this is the way we move tiers, is with the adjusted case rate. So last week, I believe we were at just over 44. We're at 41, just over 41. And so it is an improvement. It's a modest improvement. We do need all Ventura County residents to continue to help us bring these numbers further down. And on that note, our unadjusted, our actual case rate is also improving. At one time, it was 153. And today, our actual one that's going to be posted or that corresponds to this 41, our unadjusted case rate is just under 62. So we went from an all-time high of 153 in the surge to currently an unadjusted case rate of almost 62. And with the adjustment factor, our true case rate is 41. Then lastly, the two other numbers that I want to highlight on this dashboard, again, this is hopefully it's very familiar, this slide, because this is how we track our numbers. And this is what we need to be monitoring in order to see how close we are to moving into red and orange and ultimately to yellow tier. And for positivity rates, we're showing an improvement, modest improvement at that. We were around 11 last week. We're at 10.5. We hope and expect that these numbers will improve, especially with the numbers that we reported yesterday and today of new cases compared to total tests. The positivity rate is improving. On the health equity, there's always variability on that one. We actually are going up just a little bit from last week. There was a couple of zip codes where the positivity rate increased, but the majority, really all but two, the positivity rate in the health equity areas improved as well. And that includes our high case rates out in the Oxnard area and Fillmore, for example, it did improve. And so, there's variability in these numbers. I think overall it continues to show a good trend. But we do need everyone's, again, continued diligence around the safety precautions because our numbers need to improve further. And as we see, there's improvements also in terms of the vaccine, but we're not going to see the herd immunity, true community effect in months from now. So we do need to still wear your mask, practice good hand hygiene, and limit your gatherings and not socialize with others outside of your household. All right, so with this slide, on the right-hand side, the orange line is the testing rate, the testing volume, also during the surge. You can see that in early January, it was at all-time high. It's still excellent. Again, only to San Luis Obispo, we're at 800 average daily tests per 100,000 residents over the last 7 days. We're, as you can see, that yellow line lands around the 800 there. But if we look at the case rate information, that's on the left-hand side is the numbers to look at. And the purple line and the blue line there is the unadjusted and adjusted case rate. You see that we continue to go in the right direction down. But you can also see that we did experience quite a big surge and a long one at that. But we are definitely on the downward trend, and hopefully we won't have any impact to this good trend. Next, please. These two last slides are a little bit different, although in the past I think we've showed, the other. I've referred to two additional surge curves. So first you have the cases. That was a previous slide. This one is on hospitalization. This is what does that curve look like? You also see a very good improvement. You see the highs there in the early January. And now you see a very downward trend. The purple is those in the hospital that are not in the ICU, and the gold line shows our number in the ICU. Both overall numbers are improving, and so while we were in the mid 400s at our all-time high, now we are less than 300. And so we expect that these numbers will also improve. And again, we thank all the hospital workers have been working so hard to treat this many patients. They're getting a little bit of relief here with these numbers, but they're still high. We need to bring them way down. Finally, in terms of the third curve, if you will, you see here that these are deaths. They do vary a lot. But in early January, we had an all-time high of reported deaths, over 20. And now, we're at times in single digits. Today, we're going to be reporting 5, as I mentioned earlier. The daily count on deaths, they can increase up to the last 2 weeks because that's how long providers have to get us the death certificate and for us to review it. So the numbers in the last 2 weeks will probably increase a little bit, but overall you see the trend on this curve that our numbers are improving even with this lagging or delayed indicator being death. So our hearts still go out, thoughts and prayers with those families that have been impacted with the ultimate sacrifice of passing away due to COVID, but it is improving. And so with that, I believe that are all my slides. Thank you.
Thank you, Mr. Vargas. And absolutely, our heart does go out to those who lost their loved ones. It is really hard to see those numbers. And I know that while we're seeing some good information out there in terms of where we are today compared to where we were a couple of weeks ago, we are certainly still not out of the woods. And I believe we have Supervisor Long would like to talk.
Yes, Madam Chair, thank you so much for the opportunity. Rigo Vargas, I really appreciate the update on the trending. And I know that there was some concerns with the Super Bowl and people having house parties. But I believe that also with opening up the businesses, that hopefully this is relieving some of the stress based on the state's stay-at-home orders. Well, when would we find out if that is the case? Or I'm just looking at trends, trying to see how we can get even farther down. I think what are ways and we can reduce it. Vaccines. I mean, I'm sure it's probably redundant, but I just need to remind people.
Sure. Thank you, Supervisor Long, for that question. So, yeah, it's usually, minimum 5 days, 7 days after exposure that then people are getting tested and we get the results in and that the virus would be detected. So, it could be later this week, but really early next week when we expect to see the impact. Hopefully not an impact, but if there is going to be an impact to gatherings associated with the Super Bowl on Sunday, that about a week later, 7 to 10 days is when we would actually see the impact. So we're really hoping that Ventura County residents remain strong and diligent, and that our trend will not be impacted by gatherings associated with the Super Bowl. But we're definitely going to keep an eye out. And so for at this time next week, I think I'll be able to share to see if there was such an impact. In the meantime, again, it's all the guidances that we all know very well that need to be adhered to still. Limit gatherings, wear your mask, and wash your hands frequently, and get vaccinated if it's your turn, and realize again that as important as vaccines are, and that will be the way that we get out of this pandemic. Nevertheless, for herd immunity, that'll be months from now for community-wide benefit and effect. And so in the meantime, we still need to do all that we know we need to do to bring these numbers down. And just as a reminder on that is that our next target case rate number is 25 for those schools that have not opened. Especially there's several middle schools and high schools that have not been able to open. They will be up to their school district and their board to decide if they will open as soon as we hit the mark of 25 case rate. Again, we're getting closer. We're at 41, an improvement slightly from last week. We hope that in a couple of weeks we'll be at 25, and then after that, the next goal is for us to be under 7, so that will then get us on a path towards the next tier, which is red.
Thank you so much for covering that. And you know how important the schools getting open is to me, so I appreciate that. Thank you.
I believe Supervisor Ramirez has a question too.
Could you say just a little bit more about the more transmissible virus? Is it something that we are finding in our county in any particular area, and any change in the protections we need to take? And people who are vaccinated, they are still able to transmit this, right? By touch or some way. I think it's my understanding that even people who've been vaccinated are not totally immune from passing it in some way.
And Supervisor Ramirez, I think this is a perfect transition into Dr. Levin. Is that who we have coming up?
Yes, that's correct. Thank you, Chair Parks.
Thank you.
Thank you.
Good morning, Chair Parks, members of the board, Mr. Powers. I'm Robert Levin, health officer. And this is exactly what I was going to focus most of my comments on this morning, were the variants. We've been hearing about COVID-19 variants for weeks now. They're the United Kingdom or UK variant, the South African variant, and the Brazilian variant. And the most common one in our state is the UK variant. there are over 150 of this UK variant documented so far in California, with the number of cases said to be doubling every 10 days in the United States. While there's a hint the UK variant may be in Ventura County, we haven't been able to prove that yet. The CDC has analyzed 500,000 coronavirus tests and hundreds of RNA samples and predicted that in a month, the UK variant could be the predominant COVID-19 virus in the United States, overtaking the Wuhan virus. This is significant, not because the variant is more deadly, because it's not, but because it spreads about 30% more readily than the older Wuhan virus does. Just, I think, because it's reassuring to me, both vaccines we have in our county protect us from the UK variant. The South African variant has been found in our county 6 times in 3 different places. We're concerned about it because we think that we may be less protected from it by at least some of the vaccines. And finally, the Brazil variant, which is not only more contagious, but maybe more dangerous to us as well, was first found in the United States at the end of January. It was seen twice in 2 different places. We've not seen that spread or documented that spread in the United States so far. Slide, please. Between manufacturers ramping up production of the 2 vaccines we already have and encouraging news on a 3rd COVID-19 vaccine, the Johnson & Johnson single-dose vaccine, which is expected to be available within a couple of weeks, Dr. Fauci said yesterday that he expects we will soon be seeing a 16% boost in the nation's vaccine allotments. Sounds like a lot. From our perspective in this county, as comments were made earlier, we could tolerate an 800% or 1,000% increase in vaccination for our county. We would welcome it. We would have that capacity to give it. A 4th vaccine we may be seeing in the United States in a couple of months is the vaccine from England, the AstraZeneca vaccine. The bad news about that vaccine is that researchers have suggested that AstraZeneca offers as little as 10% protection against the COVID variant first seen in South Africa. It may, however, offer protection against more serious infection or consequences of that South African vaccine, which would be hospitalization and deaths. And while this alerts scientists to a potential setback and increases concern that some of the emerging variants of the virus may be resistant to some of our vaccines, you've got to look at this on a vaccine by vaccine basis. So tests on the Pfizer vaccine, one of the 2 vaccines we're using in this country and that we have in our county, found that it provides solid protection against the South African variant as well, using antibody-containing blood plasma from 20 people who had recently been immunized with 2 doses of the Pfizer vaccine. The antibodies were 81% as effective at neutralizing or basically killing the variant virus, the South African, as they were at blocking the older Wuhan virus. So we should expect the same of the Moderna vaccine. So in summary, variants will inevitably come to Ventura County, but the vaccines we have will appear to be protective against at least the ones that are most pressing. And meanwhile, the vaccine makers are all producing boosters that should protect us from variants as they evolve. I think that everyone now that we've been through what we've been through accepts that we should wear masks in public settings, socially distance, and avoid gatherings consistently. But aside from vaccination, this is our best protection against the spread of these variants. Variants need new people to infect in order to multiply and to further mutate. And I'll just touch for a moment on the Super Bowl, and that is, as Mr. Vargas said, that in a week or 2 we would see an increase in numbers of our tests, and it would be a week or so after that, maybe in 2 weeks, that we would see our hospitalizations going up if we are seeing an impact from the Super Bowl weekend. And then going back to our variants, the mutations I've reported on before that were discovered in the sewage water in Oxnard, good news. But again, I've got to pause for just a moment to thank Mike Schaefer, Alexander Hamilton, State Assembly Member Jackie Irwin, and the Ventura County Community Foundation, who had the foresight to collect this information for all of Ventura County. The specimen collected 3 weeks ago, you may remember, detected one mutation. The specimen collected 2 weeks ago found the same mutation, and now a new, even more transmissible mutation. The specimen, the most recent one, collected 1 week ago, showed a decrease in the amount of the first mutation and none of the second mutation. This means that the mutations that we have found in our county have either decreased or gone away altogether. I doubt the latter, but this is at least very good news that the mutation with increased transmissibility has not gained any ground in our county. This buys us a few weeks and maybe months, and maybe by then we'll have given out enough vaccine that this will become a moot point. Next slide, please. The last slide shows the amount of COVID in these weekly specimens of sewage water that have been taken in Oxnard. And this sampling tracks the amount of COVID cases in our county as well as the COVID mutations. It may be that we saw a decline in the quantity of those two mutations, one disappearing altogether, because simply we saw a decline in the overall representation of COVID in the samples that were taken. But in any case, it's good news that we're not seeing increases, as I said. And I think it's really interesting that we can track the progress of our fight against COVID in this manner. So I'm happy to take any questions.
Thank you, Mr. Levin, Dr. Levin, excuse me. I do have a question. I know that Dr. Fauci has also come out and said how important it is to get that second shot too. Because I know at one time, we were thinking we could spread it to more people, that first shot and get some immunities. Mm-hmm. But I think it was related to the variant specifically as to why we now really need to make sure that everyone gets the second vaccine also.
It's a really good question. And that is that what Dr. Fauci proposes is that by getting that second booster dose of vaccine, we not only get a higher level of antibody, but we have a wider spectrum of elements in that antibody that attack that part of the virus that binds to our human cells more effectively.
Okay, so that helps a lot with that strategy. Is that no, we don't want to just focus on the first to spread it wider, but make sure that we can do that second dose. And as I understand, I think it was mentioned earlier, Los Angeles had to just say, we're not doing first doses because we really got to get those second doses in. But I know we're working on doing both, and I really appreciate that program. I think, and you did mention, but I also want to thank Assemblymember Irwin and that again, talking about those partnerships out there. That's really good government that we are able to see that, yes, in Ventura County, we know what the variants are because of that Oxnard sewer study too. So good for that. I know we have some other questions, and we'll go ahead. Supervisor Long.
Thank you so much, Madam Chair. Dr. Levin, just recently the state of California has announced that places of worship can now offer services indoors following the industry guidelines with modifications, and that capacity is at a 25% indoors. So my question to you is, I have some community members that are funeral homes, businesses, and so the request is to, since those are also services that they fall within. I think in the very beginning we've had that where any services that were either in a church or a funeral home was allowed at the 25%. And so I needed confirmation, or maybe if you could follow up with me at a different time.
You know, I believe that Mr. Vargas was in contact with the state about that just yesterday. So I see he's still on the call, and I'd rather he address that, if you don't mind.
Oh, thank you.
Yeah, thank you, Dr. Levin and Supervisor Long, for that question. We submitted that question and got a preliminary response that the state, they're reconfirming, but it appears that the change only applies to actual places of worship, the actual church service, and not the funeral services. But they did tell us that they would reconfirm that. And yesterday I followed up with them. I've not heard back on that reconfirmation that the 25% indoors applies only to the actual religious service, not so much the funeral service.
That's interesting, because I do know, based on unfortunately having to go to funerals, that they do have services inside with all of that. So please let me know. I think that's really important for our community to understand. And I hope the state reconsiders. Thank you.
And I think that's the end of the questions from the board at this point, and I'll turn it back over to you, Mr. Powers.
Thank you, Chair Parks. I would like to go back to Mr. Vargas on a point about the case rate and our targets.
Yeah, thank you, Mr. Powers, Chair Parks, members of the board. I need to clarify something I mentioned regarding our next goal with regard to case rate and schools, and I apologize for confusing things there a little bit. You know, the next target of 25, that applies to schools K-6 that have not opened. They will be allowed to open once we hit a case rate of 25, and again, that's K-6. Middle schools and high schools that have not opened, they can open once we reach the red tier, which is a case rate of 7. So my apologies for confusing that.
We still have a ways to go to get to that 25 still, but we are going in the right direction.
Thank you, Mr. Vargas and Chair Parks. And so next up, I want to give your board and the community an update on our business grants. And so I'll turn it over to Mr. Stamper.
Thank you, Chair Parks, board members, CEO Powers. I'm Paul Stamper with the CEO's office. And we have an item coming to your board later today on the second business grant program. And we will be asking for your approval of the final terms to allow us to move forward with the $20 million in funding your board's identified for distribution to local businesses and nonprofits. So more on that to come. We are continuing to message and provide support and assistance for local businesses, make sure they're aware of all the programs and assistance available. edccollaborative.com is a good place to go for a full listing of resources and webinars. We also have much of that information on our VC Recovers website under the business information section. And this is much more than just financial assistance. It also has a wealth of other information that can be useful to businesses. For instance, if there's an outbreak, the public health guide is there related to that. So there's a lot of good business-centered information there available. I also wanted to mention that the California Relief Grants program, the second round of applications, ended yesterday. And so notifications for that will not be coming out till later this month. But I thought it was a good opportunity to share a short story with you all. We send out regular newsletters to our over 15,000 businesses that have registered with the county. And last week, a business owner received one of those newsletters. We'll call him Joe. And he called and said, you know, I've already received a grant. Am I eligible to apply for this? And with some searching, we figured out that he had received one of the county's grants in our first county program. And so we encouraged him to apply for the state program. Then on Friday, he contacted Gloria Martinez, our county economic vitality manager, because he was having issues with the state website. And she was able to connect him to EDC, which is one of the state partners supporting that program, and stayed in touch through the weekend until it was resolved. Then yesterday, the last day of the program, Joe received an email from the state saying his documents were missing and he was having trouble getting through to get support. and panicking a little bit that the window was about to close. And Gloria was able to reach out to our contacts at EDC, who elevated the issue to the state, and they were able to get it resolved by the end of the day. So I think this is just a good example of the type of service that's happening on a daily basis out there. I wanted to share that with you, and I'm happy to take any questions.
Thank you. And I'm not seeing any questions at this time. Really appreciate the hands-on work that we do with each of our businesses. And that also goes into the business ambassador program that we have to really helpful to the businesses so they have a resource out there and it's local and they know that we're there for them. So thank you so much for that. And later on our agenda, we'll be looking at a significant addition to the grant program so we can reach more businesses and potentially help those that we have already assisted to some extent. So thank you.
Thank you, Supervisor.
Thank you, Paul, and thank you, Chair Parks and board members. And that's our presentation for today. Our vaccine administration and advocacy for more supply, that's our priority, and we'll continue to do that. Appreciate your support and the community support. Happy to answer any questions.
Are there any other questions that the board has? Supervisor Ramirez?
Yes.
Let me, if you don't mind, Supervisor Ramirez, I know that Supervisor Long also has a question. Can you please go, Supervisor Long?
We're going to do our board comments at 1 o'clock, is that correct?
No, we are going to do our board comments at 1:30.
Oh, sorry, thank you, 1:30, okay. I do have a journey memory for one of our members with COVID, and I will do that at the 1:30.
Yeah.
So I first of all just needed to clarify that. But first, I just want to say thank you to the whole team in regards to COVID-19. I would just really appreciate the nurses, doctors, staff that are working so hard at our hospitals to ensure that our patients come out of our hospitals well, and want to just appreciate them for all their efforts. I know everyone is so eager to go back to the normal, but there is no new normal. And I just urge everyone to go to our businesses in a safe manner, using your masks, or buy from them online, and just follow the procedures that we need to make sure that we're not spreading any type of germs, and really support our businesses and our schools alike. And so sorry to the families that have lost their loved ones due to this pandemic. And thank you very much.
Yes, thank you, Supervisor Long. Yes, at 1:30, I know that we will be closing in honor, particularly for two individuals that are close to us who have died from COVID. Just really emphasizing how real and close this disease is to everyone, and how important it is that we, as the Board of Supervisors, as the county, do what we can, but it does take all of us together to end this pandemic. I'll go back now to Supervisor Ramirez.
You know, this has been a very difficult presentation for me. I think many people know that I lost my brother this weekend to COVID. He was at Community Memorial. He was well taken care of. Our family is totally devastated. And to those who think this isn't real, I'm a witness to the horrible reality of it. So all of you who are still here with us, please take it seriously. Be safe. Protect your loved ones. Hug them. You don't know how long. We never know how long we have. But once it's gone, you really know what you lose. That's all.
Thank you. And our hearts really go out to you, Supervisor. And I will give us a little time to 1:30 to give our thoughts and prayers, and also our heartfelt love to you that for what you have gone through and your family has gone through. But at this time, we have item 32, this is another example of our Board of Supervisors, our county coming together for our community, and all with the intent to ensure that we keep people to the best of our abilities healthy and safe, and also to help the businesses so that be able to keep their employees employed, that they can afford the extra costs it takes to do that preparation, to be able to safeguard the community and their employees, as well as their customers. So we're going to look now, this will be our second set of business assistance grants, an additional $20 million, and going not only to businesses, but also to nonprofits in our community. And these are the smaller ones that are the ones that we have found that are most struggling. And I really want to give our appreciation to be able to put this program together and find a partnership that can help us to vet those applications and ensure that the businesses get their checks, their grants in a timely fashion. So I'll go now to Mr. Powers, if you'll be doing this item, or back to Mr. Stamper.
Thank you, Chair Parks. Yes, I'll turn it over to Mr. Stamper. Thank you.
Thank you, Chair Parks, board members, CEO Powers, Paul Stamper with the CEO's office. Today we're here to request your board approve terms for the second grant program. So the board letter and exhibit outlines the terms of the program that we are recommending, and we're asking for you to authorize our CEO to make minor modifications if needed during the implementation. There's an estimated timeline here that we offer for you. We're aiming to have the pre-registration happen in the middle of March, the application window itself late March, and payments to eligible and compliant prioritized applicants late April. And then a follow-on with businesses that were able to move into compliance, make additional awards in May. So this program represents over 8,000 hours worth of work. And we've learned how difficult and challenging these programs can be, and I'm hearing that from other partners as well. Our first program here at the county took over 8 months, and we're aiming to do this one under 4 months. So it's an aggressive timeline, and our specific dates of those items mentioned above will be published as we get closer to them. We want to move down the road a little further and don't want to publish a date until we have high confidence, so that we don't mislead the public. We want them to be able to count on the dates once we put them out there. And so that first milestone is the pre-registration piece that will publicly be out there. And so we're certainly committed to advertising in advance of that and making sure your board and the public is aware of that before it happens. And that pre-registration will allow businesses and nonprofits to log in, create an account, begin uploading documents, and have full access to all the program information that we've developed. There will also be a call center and webinars that will start in conjunction with that to make sure we can get questions answered as that opens up. And then I'm planning on a 1-week application period. So a total of about 2 weeks if you include that with our pre-registration period, where businesses can be interacting with us to get that application situated. And then the application review process is what takes the most time. And so, depending on the number of applications we get, that may have an impact on our timeline. We're currently estimating about 5,000, which is similar to what we received last time. But of course, if we receive 2,000 or 10,000, that will change how we're able to move through this process. And so we're committed to, giving your board regular updates as we go. If I could have the next slide, please. Thank you. So the exhibit with the board letter takes you through all these different categories of the program parameters that we've identified. And so the eligibility criteria and priority factors that your board has given to us, those will be set. Those are not the types of changes that we're talking about. Some examples of possible minor changes might be, interpretation. We found that no matter how detailed we are, In these documents, there's always the possibility for unanticipated questions and nuances or interpretation that then are formulated into facts to clarify those. There's also some areas in here like which documents will ultimately be allowable for the upload process to prove certain items of eligibility. And so some of those smaller areas we may need to adjust as we work our way through this full program design and implementation. But we are certainly going to be, staying consistent with your board's direction and wishes as it relates to the main tenets of the program. If I could have the next slide, please. So I just wanted to revisit some of these main eligibility requirements that your board referenced. And again, there are others that are detailed more specifically in the program parameters document. But we want active businesses that have an active license and a physical address in the county. This represents a change here, the businesses before 2021. And it's consistent with two things. One, your board indicated the wish to offer assistance for those businesses that were just starting out during or right after the pandemic hit. And also it's seeking to balance or design a program that can move quickly. And we simply found in our analysis that it's much easier and faster to figure out if a business has been open before 2021 than it is to figure out if they've been open before June of 2020. And so we're staying consistent here with the revenue of 25,000 to 2.5 million. Businesses need to have been impacted by COVID-19, and they need to be in compliance with the state and local orders, which is detailed more specifically in that document as well. And then we do not want recipients from our first grant program to apply to this program. As CEO Powers has mentioned in the past, if in fact we're undersubscribed, and then we may revisit that. But we want to move through this quickly, and we are going to focus on those that have not received a grant yet. And these priority factors that your board's identified are outlined here: women-owned businesses, minority-owned businesses, veteran-owned businesses, businesses located in low to moderate income communities, which is in alignment with the state's recent California Relief Grant Program, which means that it's based on census tracts, and it means 50% of the population is at 60% of the average median income or below. And then we also have the priority factor of if you have one or more employees. Next slide, please. So I just want to reassure your board that we are planning for a robust outreach and communication, which will include advertising in all the different mediums that we do for these things, working through our partners, our chambers and other business groups to make sure the word gets out, and paying particular attention to our low-income communities to make sure the message gets out there. We have, we'll be giving your board regular updates. And for right now, for businesses and organizations interested in the program, we encourage them to go to VC Reopens, that's vcreopens.com, and sign up to receive updates there so that they can have direct communication about the program. And then, of course, we will be having a website and a hotline included with the program so that there's easy access to answer questions as they come in. And with that, I'm happy to take questions.
Thank you. Could I ask that you bring up on the screen the qualifications, the criteria that you're looking at? And I'm so glad that we have added the criteria so that we're looking at particular businesses as we prioritize. It may be that we'll have enough funds for everyone who applies. The ones where it talked about veterans and minorities and in the local disadvantaged communities, if I recall. Wasn't that slide? There you go. Women-owned, minority-owned. You also mentioned have one or more employees. And I'm wondering if we could go a little bit deeper there than just one, or at least 3, for example, or even 5. Because I think sometimes when you become incorporated, you may have a family member be your, listed as a secretary or co-owner, and it's easier to have one employee, but the goal that I would like to see, one of the goals is to see that we can keep as many people in their jobs as possible. And this might even encourage some of the businesses to bring back employees, because they'll have the extra funds to do that. So that's something I would just throw out there. Instead of one or more employees, that we add to that. And that would be my request. Other supervisors, comments?
Yes, Madam Chair, I understand you're wanting to get as many employees funding as possible. However, I have great concern in throwing or in changing it to 3 or 5. I don't see the numbers and the data associated with how many companies that would affect. And my concern is if we do limit it, that we're not getting the funding out to the businesses as quickly as possible. I think there's a lot of parameters here, and I just have concern with putting more rules and regulations along with trying to get the businesses their funding. I just think they're going through so much, and I have concern on that one. So I'm not sure I could support that change. I just want these checks out. Thank you.
And obviously this isn't something that would knock someone out from getting a grant, but if we had 2 choices in the end of some employer who has 7 employees and one who has 1, I would prefer it go to the person with 7 employees. And I don't see it as knocking that other business out unless you get, more applications and there are funds. But I think that is a good criteria to look at and I think that was put in as something I had requested too. And it was actually started at the federal government with the PPP. And the whole point of that funding to businesses was specifically to try to keep employees employed and see that we can keep them out of the unemployment line. So I think it's an important one and would ask that the board consider. And seeing that your concern, instead of 5, I would say, well, let's have at least 3, but just one other employee to me doesn't seem to reach the impact that the desired criteria is meant for. Okay, any other board members have questions or comments? Okay. And does this complete your presentation?
Yes, Supervisor. Okay.
I would like to go ahead and make the motion then, and that we approve these final terms for the counties. Well, actually, before we go there, could you address my comment about and hearing what Supervisor Long is concerned about if we change it to 3 instead of just 1? Do you see that as having an impact that will knock businesses out and unduly?
Yeah, Supervisor, I think we're dealing with, it is an unknown, right? We don't know how many applicants we're going to get and what their profile will be. I will say with the restrictions we've put on the revenue requirements, it's likely that many of the applicants will be very low employees, or number of employees. I do think it's possible that there will be additional effort associated with a count of the number of employees as opposed to have employees or not. It is doable, but those are considerations.
Do you think it will complicate the ability to do these grant programs and it will be more difficult if we choose a different number than 1?
I believe it will add an extra step, yes.
Okay, well, I think it's important to get these grants out sooner, and so I don't want to complicate that. So with that, Supervisor Levier, would you like to?
I appreciate Mr. Stamper making that clarification, because that was the question I was going to have in terms of what the complication would be. And I just, given what he said, I seem to agree with what Supervisor Long said in terms of getting this program moving forward. And I appreciate you raising that, Madam Chair.
Thank you. Yes, Supervisor Long?
Madam Chair, I really do appreciate your thoughts on this, but with sitting on the EDC collaborative and understanding
what all these businesses are going through with the grants and the checks and balances and all the paperwork that goes into it. I just really have great concern on adding one more step onto it. But I really appreciate the efforts and making sure that the most people we can get with salary supplement, I think is important. But I just have concern on that. Thank you.
Mm-hmm. And it would be great also as we move forward to get that feedback later to find out the performance of how we did. And I know you do that regularly, letting us know how many were veterans, how many minority. We'll find out. I'd also like to see that broken down and how many employees. So, but certainly don't need to complicate the actual giving of the grant. So with that, I'll go ahead and make the motion to approve the final terms for the second business assistance grant.
Huber, second the motion.
Thank you, Supervisor Huber. And with that, could we please have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes, and thank you to all of you for your hard work in these difficult times.
Supervisor Ramirez.
Yes, and thank you also.
Chair Parks.
Yes, thank you. And it's great to see that pass. I do feel like we've got some good news out there for our community, not only our businesses with this additional 20 million in grants, but also now that 65 plus can now register for vaccinations also. I think this is great, and also seeing our numbers going well. So we got to appreciate those small steps and while we can, because these are tough times. I think the next item on the agenda, and correct me if I'm wrong, would be item 31. And that would be our regular agenda. And that would be with Supervisor Huber and your recommendation.
Yes, thank you very much. I would like to recommend the appointment of Ms. Jennifer Morrison to the Ventura County Behavioral Health Advisory Board. Ms. Morrison reached out to me several months ago to express her interest in serving. She resides in the 4th District and will be serving in the capacity of a family member of a consumer. I'm aware of additional unscheduled vacancy from my district. I'm committing to advertising in English and Spanish for applicants, and I'm further making it my top priority to fill that seat with a consumer. I would move approval. Thank you.
I'll second.
Thank you so much. Thank you, Supervisor Huber. I know we have a little bit disproportionately more family members than we have consumers. So I do very much appreciate what your last comment was, is that you will be prioritizing with your next appointments, trying to get consumers. And it's really an important voice to have at the table. So we do have a motion and a second. Can we have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. Next item on the agenda then would be agenda item 33, and this is with our Behavioral Health Department, appropriately. This would be to add 2 additional positions to our Integration Incentive Program grant activities. And I believe we have, for this presentation, Dr. Savette Johnson. And is she available? Yes, I see her. And go ahead, Dr. Johnson.
Good morning. Thank you, Madam Chair, supervisors of the board, CEO Powers, and all watching today. I come before your board to present item 33, asking your board to approve a resolution to add 2 new position allocations for the Behavioral Health Integration Incentive Program grant activities that would begin February 21st, 2021. And this add is to add delete. So we would be adding 2 positions, but we'd also be deleting 2 positions. So it would be a net neutral in terms of full-time positions in the department. On December 8th, 2020, your board approved the Memorandum of Understanding between the Healthcare Agency and Gold Coast Health Plan, accepting the BHI Incentive Program grant funding and a little over $6.3 million. Of that, Behavioral Health received about $1.3 million in funding for 2 projects. The first being medication management for beneficiaries with co-occurring chronic medical and behavioral health diagnoses, and the second is improving follow-up after hospitalization for mental illness. Utilizing these funds, VCBH would hire 2 positions, a behavioral health manager and a behavioral health clinician. They would serve the function of improving care coordination between behavioral health and 2 Ventura County hospitals, Hillmont Psychiatric Center, also known as the IPU, and Vista Del Mar. They both serve the county's Medi-Cal beneficiaries, and with improved communications and data sharing during the hospitalization and discharge planning process, we'd be able to enhance and ensure that post-hospitalization outpatient follow-up with the additional support of the care coordination team, and employ performance indicators and data tracking system reports to monitor the effectiveness of this program. I'm available for any questions that your board might have regarding this.
Thank you. Great improvement. Brings some more seamlessness into the work for treating our patients. I'm not seeing any questions, so do we have a motion?
I'll move staff's recommendation.
Huber, second.
Thank you very much for your motion and the second. And could we please have the roll call?
Supervisor LeVere.
Yes.
Supervisor Long.
Yes, and I would just like to say, Savette, thank you so much for all the hard work going on in Santa Clara Valley, especially. This is just a great team, and our community is really working well with you, I believe. So I wanted to say thank you for all your efforts.
Of course, thank you for your support.
And also, Supervisor Ramirez, did you have a comment?
No, I just wanted to say yes, I agree.
Okay.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, great. Thank you.
Thank you.
And let's see, our next item is our time certains. We do have a correspondence agenda we could vote for. That'd be item 40. Do we have a motion?
So moved.
Thank you.
For second.
We have a motion and a second. Could we please have the roll call?
Supervisor LeVere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes. And that gives us a little bit of a break in our meeting. We could either go to closed session or we could take a recess, and I'll ask Mr. Powers for his advice.
At your board's pleasure, we could do some closed session items, or we've got time in the afternoon as well. So
let's go to closed session.
Okay, we're going to go to closed session. We will be back at 11 a.m. for our next hearing on our Parks Department fees. So with that, we will stand at recess while we are in our closed session. See you all at 11 a.m. Thank you.
thank you.
Okay, good afternoon. I guess it's still morning. That's good. Good morning. We are back into our Board of Supervisors regular meeting of February 9th. And before we go to our time certain, I first want to turn it over to our County Council to make an announcement regarding item 42 on our agenda.
Thank you, Chair Parks. With respect to item 42, the Board of Supervisors has approved and authorized County Council to enter into a settlement agreement, in this case, County of Ventura versus Anytime Power Partners 3 LLC, which involves 2 Anytime Fitness gyms in Ventura on Johnson Drive and on Thompson Boulevard. Both gyms, after being subject to a temporary restraining order, have come into compliance with the applicable state health order. And based on that, those gyms have agreed to enter into a settlement agreement that requires them to continue to comply with any applicable state or local health order. In exchange for that, as well as a general release from the gyms, the county will dismiss the lawsuit with prejudice, with all parties to bear their own costs and no monetary penalty being imposed against the gyms. The lawsuit will be dismissed once the settlement agreement is fully signed, most likely later today or tomorrow. And the vote approving the settlement agreement by the board was 5-0. That concludes the announcement.
Thank you, Mr. Walker. And it's good to be able to drop the litigation and have the business in compliance. And that is the only goal with that. So good news on that front. Thank you very much. And now I will take us to our 11 a.m. time certain items. And the first is item 34, and this is a public hearing. So I'll open the public hearing, and this is regarding our parks. And I will ask Mr. Chisholm if he would please present for us. And Mr. Chisholm, are you available? This is regarding fees for the parks, correct?
Yes, can you hear me?
Yes, thank you.
Excellent. I will jump in. And very good morning, Chair Parks, members of the board, CEO Powers. Thank you very much for the opportunity to present our suggested changes to the Ventura County Parks rent and fee schedule. We do review this schedule annually to ensure we're aligned with comparable rates and policies. We also strive to provide a great value to our broad customer base when considering our fees. Our County Parks Department does operate as an enterprise fund where 90% of our operating budget is derived from the fees we collect. We therefore do consider operating costs with our fees to some extent. With this year's review, we targeted 4 change areas that we believe will significantly improve our guest experience. First off, our cancellation policy. Currently, we begin a penalty starting 30 days out. That's a very outdated model. We're going to change that to 3 days. And we also have a layered cancellation policy where you have a full penalty 7 days out. All that'll go away. There'll be no penalties until 3 days out. So we hope that's very favorable to the customer and simplifies things on all sides for us as well. We also want to cap the use fee loss. Currently, if you have a 14-day stay at a full hookup site, you might have a fee about $700. If you canceled 7 days out, you would owe us, that full $700. We're going to cap that at $200. We think that's fair and won't affect our business model. So we wanted to offer that to our guests. We also want to retain our voucher program, but eliminate the automatic issuance. Last year, because of the aggressive cancellation policy, the 30 days, there was some tweaks made to the cancellation policy to make it more favorable. That resulted in one of those things was an automatic issuance of a voucher up to the minute before your reservation started. That put in place a pattern where people would book a bunch of times throughout a season with plans of only using one of them, and they would just cancel last minute, and we wouldn't have the opportunity to offer that spot to another guest for a few days because it takes people a few days to get organized and get booked. So we want to keep our voucher program, but switch it back to how it was for the years before, which is for unique scenarios, emergencies, and has director approval. Our second area, we want to take our weekend and holiday rates and just apply those to peak season. What that does for everyone involved, if you have a reservation and you want to move it by 1 or 2 days, any time of the year, you're going to see a $1 to $2 increase or a few dollar surplus. So we have all these micro adjustments we have to do, charge or refund for changes. So we'll simplify it for everyone. It's also unintuitive for our guests to know is it $32 at the Rincon or $35, and it changes all the time. So we want cost impact will be very similar, but we just won't have the transaction chores for both the guest and ourselves. And our last area, we want to suggest 17 changes to suggest adjustments, if you will, to our 17 of our 85 fee line items. All of our community center fees, permit fees, the majority of our fees will remain unchanged. this year, but we're suggesting the 17 we're suggesting are exclusively put on our camping, and most of them are in the $1 to $2 range, with the largest change being to our full hookup beach RV sites. Currently, the cost of pumping, and if you look at comparables as well, we're well lower than even a Lake Cachuma or Lake Casitas for a full service, and those are for beach parks. So the cost should be more. We're $20, $30 below what you'll find other beaches charging for full hookups. So that's seeing a 10% increase because we want to get away from the other campers subsidizing that higher, more deluxe sites. So those are the highlights that we're suggesting, and I'd be glad to provide any detail or answer any questions at this time.
Do we have any questions from the board members on this?
Yes, Madam Chair. Thank you, Mr. Chisholm. I just wanted a clarification. If someone comes up and sees a spot open, how would they register? Can they do it online? I'm just concerned about our rangers having cash or something of that nature. So
yeah, so excellent question. We have a mobile site that you can book on your phone in the site, and our web-based reservation system. We do hope to combine those in the future where it's just one system. The reason we can't today is if our web-based system, if everyone in the field is pinging that and looking, it shuts the server down for our software. So we want to get there, but there isn't cash handling. Cash is for showers at a few of our inland parks and things like that. So we're not cash handling at this point. That was only a couple years ago that we went to that.
Thank you for the clarification. Appreciate it.
Great. Are there any other questions? Okay, I'm not seeing any. Thank you for the report. Thanks for going through and updating, and it seems like we're making it more user-friendly in some instances, so happy for that. I'm going to go ahead and close the public hearing then, and with that, I will look for a motion.
Long, a motion approved.
Thank you. So Supervisor Long has made a motion.
I'll second.
Thank you. And a second from Supervisor Levere. Could we please have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber. Supervisor Ramirez.
Yes.
Logged on here, so
Chair Parks.
Yes, thank you. And with that, the motion passes. And we'll now go to item 35, and this is a second hearing, so we've already heard it once. And this is adoption of a ordinance, and I'll turn it over to Mr. Atten.
Thank you, Supervisor.
my desk. I'm sorry.
Thank you, Supervisor. So actually, Marjorie Deal will present this item.
Okay, and back again. Thank you.
Supervisors and CEO Powers, how are you all this morning? We're here just for the second hearing for the Assistant Director of Public Works Agency. As you know, this is the highest ranking after Jeff Pratt, and it deserves to be in the unclassified service. So this is what our board letter is all about, and we're asking you to approve that we will make this an at-will position. I'm here if you have any questions.
Okay, and do we have any questions on this? And again, as I mentioned, it is a second reading. Not seeing any, then let's go ahead and
Chair Parks.
I'm sorry, Supervisor Ramirez.
Just a real quick question, Ms. Deal. Does someone hold that position now?
No, this is a brand new position. It is never been held before. Jeff has 5 direct reports, and this will alleviate some of that responsibility so that he has a second command.
And there'll be an open recruitment?
I'm sorry? Yes, there will be an open recruitment, an open search for a appropriate candidate.
Thank you very much.
Okay, and then with that, I'll close the public hearing.
Huber, move approval.
Thank you for the motion, Supervisor Huber. Is there a second?
Yes. Yes, I'll second.
Okay, thank you, Supervisor Long. And could we please have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes, and thank you, Marjorie, for this update. I know the technology is hard sometimes, so thank you.
Yes, I apologize for rushing in. Yes, thank you very much.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. And so that passes unanimously also. And now we'll go on to item 36. This is also a second reading of an ordinance. And our staff person on this is Mr. Friedman. And Mr. Friedman, please go ahead.
Good morning, Chair Parks, members of the board, CEO Powers. I'm Brian Friedman with the County Executive Office Budget and Finance Division. This is a second public hearing to repeal and reenact a portion of the Ventura County Ordinance Code that establishes per diem compensation for the Civil Service Commission. This action removes references made to a previously repealed ordinance, and if adopted, would become effective 30 days from now. If you have any questions, please let me know. Thank you.
Thank you. And with this, are there any questions from the supervisors? Okay, not seeing any. Close the public hearing and entertain a motion.
Huber, move approval.
We have a motion. Is there a
second?
Thank you, Supervisor Long. And could we please have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you very much. And now we'll go on to item 37. And this is also a public hearing, and this is regarding the adoption of our service and fees for various departments. And I'll turn it over to Mr. Bravo. And Mr. Bravo, if you could unmute yourself, and when you're ready, please go ahead and present.
Okay. Sorry about that. Ready to go now.
Thank you very much.
Yeah. Good morning, Chair Parks, members of the board, and Mr. Powers. I'm Robert Bravo from the County Executive Office. In June, your board approved the current year's service rates and fees. Today, we are requesting approval of certain rates and fees for a few departments. These include for public health, we're adding and amending fees for vaccines, medications, and lab tests. For RMA, we are adding a $1,500 cannabis zoning clearance fee, and this is related to the passage of Measure O in November. And for the library, we are amending the fee schedule to reflect the board's prior approval of eliminating fines on overdue materials. This concludes my presentation. County staff and I are prepared to answer any of your questions. Thank you.
Thank you very much. Do any of the supervisors have any questions or would like to make a motion? And I am closing the public hearing before you do that. Go ahead. Okay.
Long I will motion to approve.
We have a motion to approve. Is there a second to the motion? I'll go ahead and second it. And if we could please have the roll call.
Supervisor Levere.
And Supervisor Levere, your microphone is not on.
I'm sorry.
That's okay.
Supervisor Levere.
Yes.
Thank you.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. And now, and thank you staff for the report too. We are almost right on the dot. I'll have to just say that because it's so so special. We're at our 11:30 a.m. time certain, and this is an item regarding Nyland Acres, and I believe our planning director, Dave Ward, will be giving this report. Good morning, Mr. Ward.
Good morning, Chair Parks, Supervisors, and CEO Powers. Let me pull up the PowerPoint. Do you all see the PowerPoint?
Yes, I can see it.
Yes. Okay, Thank you. Make sure
Is it also available on the screen for people who are watching?
I believe so, with GSA facilities. Yes. All right.
Yes, now it is. Thank you.
Oh, okay. Thank you. So good morning. This item before you is a report back to the board, and this takes us back a little bit in time to November 5th of 2019. And at that point, this was before Measure O, which occurred during 2020. But at this point in time, the board had asked for a report back on cannabis and whether the cannabis medical or recreational use activities and businesses would be allowed in unincorporated Ventura. At that board hearing, the board elected not to move forward with any additional cannabis uses, but they did direct staff to conduct an assessment on and report back on the feasibility of a pilot program allowing retail sales of medicinal and recreational cannabis in unincorporated Nyland Acres, with a portion of the retail sales revenue directed back to Nyland Acres community. So we are reporting back today on our analysis of this request. To provide some locational context, this is part of District 5, and this is one of our disadvantaged communities in the county, and it's part of the El Rio del Norte area plan, more specifically here in Nyland Acres shown on the screen. This request ultimately is a community-driven request. Representatives of the Nyland Promise organizations have stated that their pilot program concept was broadly intended to allow communities in the unincorporated county the option to pursue cannabis retail sales, with a portion of resulting revenues being used to fund improvements in the communities where the retail sales are allowed. They further stated that the El Rio del Norte Municipal Advisory Council has expressed interest in working with Nyland Promise representatives and voted at their June 27th, 2019 MAC meeting, requesting the Board of Supervisors to adopt regulations for a pilot program in their community. The representatives explained to staff that if a pilot program was successful in Nyland Acres, other MACs in the county who might be interested in this type of land use and revenue stream could recommend that a program be extended to other unincorporated areas. Cannabis sales would fall under retail sales in our zoning ordinance. We refer to this as retail trade and is a land use classification in the zoning ordinance that is authorized in the Commercial Planned Development, CPD, zoning district. To allow medicinal and recreational cannabis retail sales as part of the proposed Nyland Acres pilot program, the county could establish and authorize this specific land use within the CPD zoning district. However, this approach would authorize the land use within every CPD zoning district in the unincorporated area without confining it to the Nyland Acres community. In order to confine the cannabis sales land use to the Nyland Acres area, per the community request, the county could establish an overlay zone in which the land use would be allowed. Pursuant to Section 8104-7 of the Non-Coastal Zoning Ordinance, the purpose of overlay zones is to superimpose particular zones on existing base zones to establish additional regulations, such as those authorizing or prohibiting specific land uses or imposing unique development standards within the overlay zone. The county's zoning ordinance currently includes overlay zones regulating certain land uses and natural resources such as temporary rental units, community business districts, and mineral resource protections. More specifically in the Nyland area then, an optional overlay zone would be within the CPD areas here shown on the screen, and an overlay would be applied to all or a certain number of them based upon evaluation. In preliminary review of the zone districts in Nyland Acres community, the CPD zone contains 20 parcels, some or all of which would be the logical location for a cannabis retail sales overlay. Further consideration for establishing the overlay zone on certain parcels may be the location of potential medicinal and recreational cannabis sale uses in relation to potential surrounding sensitive uses, such as residential areas, daycare facilities, things of that nature. Beyond the overlay zone, the county would need to establish the permitting and other regulations one or more cannabis retail sales operations would be authorized to operate. The county could not predetermine the operators that would be permitted to engage in retail cannabis sales. Objective criteria would be needed to evaluate applications. The county could either require a ministerial zoning clearance that would be issued if an applicant satisfied specific objective requirements and standards as verified by county agencies, or a discretionary conditional use permit that would allow county decision makers to consider the county's more general subjective permit approval standards in deciding which operations to allow. A discretionary permit requirement would also enable the county to prepare and tailor specific conditions of approval to regulate the operations. Although it's important to note that discretionary permits do take longer to process than ministerial applications. The county would also need to consider establishing additional non-land use ministerial permitting requirements, such as through a specialized business license, to impose additional operational rules for criminal background checks for operators and their staff. To determine which permitting and regulatory approach is best suited to the county, the board would need to direct their preferences to staff, or staff would need to survey and evaluate other jurisdictions' cannabis retail sales regulations, since numerous approaches have been adopted statewide. The funding mechanism sought by the community. There are limitations. Staff has determined that the county could not require retailers that are permitted to operate under such a cannabis retail sales pilot program to direct a percentage of their revenues to any governmental or non-governmental entity for the purpose of benefiting the Nyland Acres community. This would switch to a taxation process to achieve what the community is desiring. If the county wishes to create an ongoing revenue stream from such retailers for this specific purpose, the means of doing so would be to impose a special sales tax on the retailers. Adoption of the special tax would require 2/3 countywide voter approval. If approved, the proceeds of the tax would generate public funds that would be utilized by the county to provide public services benefiting the Nyland Acres community. Another potential option would be for the county to seek to establish a general tax applicable to retail cannabis sales. The benefits of a general tax are that it would only require majority countywide voter approval and could establish a higher tax rate than the default sales tax rate that would otherwise apply to cannabis retail sales in the unincorporated area. The county could not, however, earmark the proceeds of a general tax for a specific purpose, such as funding projects and programs in Nyland Acres. In discussing some of these constraints with the Nyland Promise representatives, they modified part of their proposal in discussions with staff. Recognizing the difficulty for the county to establish a special tax, Nyland Promise representatives have more recently expressed a variation of their original proposal, whereby the county would allow cannabis retail sales in the community without a special tax establishing a revenue stream. As described by the representatives, a permitted operator could voluntarily elect to provide financial support to Nyland Promise without any express or implicit county requirement that the operator do so, similar to other businesses that voluntarily choose to support community and nonprofit groups through their offer of in-kind services or direct funding. This modified proposal would still require the general tax and countywide vote. In your board letter, there are public comments that are all in support of this proposal. We have a community petition of about 140 signatures as well as a couple individual letters. And I believe the Nyland Promise representatives, Marianne Rooney and Mike Barber, are going to be presenting during public comment. In conclusion, the recommended actions today is to receive and file this board letter, and secondarily provide direction to RMA staff regarding potential inclusion of an Island Acres cannabis pilot program. If your board were to move forward, this matter would return with a proposed project completion timeline, budget, public engagement plan as part of the RMA Planning Division's 2-year work plan, which is scheduled for your board's consideration on February 23rd. This is a turnaround time is pretty tight since that's only 2 weeks away, but staff would do our best to present the scope of what your board would need to direct, and we would be able to provide you some more of the details on how we would accomplish this work plan task. With that, that concludes my presentation, and I'm available for any questions you may have.
Thank you for the presentation. Thank you for the excellent report too in our packet. That it really did a great job summarizing. Do any of the supervisors have questions that they'd like to ask? Yes, Supervisor Levere, did you have questions?
Yeah, thank you, Madam Chair, and thank you for that report, Mr. Ward. Very thorough and made it very easy to understand. Just so I'm clear, we're talking about one operator on one parcel, correct?
If we were to design the program with the overlay, it would not be specific to one parcel. We'd be looking at multiple parcels. It's a challenge to identify only one parcel and do a spot zoning. You'd have to have real strong criterion to select only one parcel. So we would be looking at probably several, and we would not be permitting just one operator. We'd be looking at here are the various parcels that an operator could elect to submit an application, and then we would evaluate those against the ordinance standards and operational standards that we would establish in the new land use designation for retail cannabis sales.
Yeah, and I appreciate that. I think my question wasn't very clear. I mean, ultimately, with the direction we give you, what the community is asking for is only one operator, and ultimately, when we go through the process, we would settle on one parcel. Is that correct? Or is this going to be open to any? Assuming we do the overlay, and it looked like there were several CPD zoned parcels on there. Would it be open up to every CPD? I mean,
we would analyze within the CPDs of the Nyland Acres area and determine which parcels to apply the overlay. We'd be looking at not just one parcel, though. There'd be more correct analysis to have several parcels, although there might be only one operator that elects to apply for a permit.
Okay. Okay.
And then, thank you. And Supervisor Ramirez.
Yes, thank you. Well, this is my district, and
yes,
I will later have comments about the great work the Nyland Promise folks are doing, their actual on-the-ground work for very disadvantaged community. But I wanted to ask if you could catch me up. Has this been, the proposal by Nyland Promise, has that been tried elsewhere, or is this very creative approach unique?
There have been other communities that have elected to provide for cannabis retail sales within their zoning ordinances. The one more close to us would be Port Hueneme, and they did go through the sales tax process of the community to support this type of use, and then they created the program to implement that through their city on allowing certain operators. So there are communities that are adopting these types of programs, but they do also require the vote of the people.
Well, Oxnard is going through this as well. I don't believe they've settled on any retailers. They have a very strong set of criteria, and there's been some ups and downs with that. But in specifically beyond Hueneme, because we're dealing with a countywide situation, do we have, please catch me up, do we have retail sales in unincorporated county at this point?
We do not.
I didn't think so. So this would be a first. We see that many people in the community want this. Are you aware of anyone opposing this? I haven't heard of anyone from that particular community not wanting to do this.
I have not heard any opposition from community members.
All right, thank you very much.
And I would say it's pretty telling after the assessment, which is an excellent report, as I mentioned, that we see that, oh my gosh, not only you need a 2/3 vote, and you need to do a rezone of all, and potentially overlay zone for all properties of that kind.
Oh.
I think she just froze.
Yes?
You just froze.
I froze. Well, sorry. Have I unfrozen yet? I've thawed. Okay. But I think because of this assessment, the Nyland Promise folks have now said, hey, just let us have a cannabis retail, and we'll see if they'll voluntarily give us some funds. I think that's as I understand it. Am I right?
That's correct. That was the basis of their proposal.
Okay, and so as Supervisor Ramirez pointed out, that no, we have not in the unincorporated county allowed for the sale of cannabis, and so nor have we until we had this initiative that was successful. Had we ever approved the growing in the unincorporated county either. So this would be the first time. There have been concerns in other areas, certainly in my district, that the community, the municipal advisory councils, they do not want to have the selling of cannabis in their areas. And I know that the Sheriff's Department has had concerns about crime associated with this type of a sale. I know when Supervisor Zaragoza brought this forward, he said he's only looking at Nyland Acres. It's his district, and I think it was kind of the rest of the board felt that we would give him that option if that is doable. Seeing now with this assessment, it seems to me it would be an incredibly burdensome to our planning department to go through this for just Nyland Acres. And in addition, it would be very expensive, obviously, to do a vote, and probably somewhat difficult to do that 2/3 vote. So I think that they're, getting the message and saying, let's just allow us to have this kind of business in our community, and we can work with the retailer who, as I understand, we have no oversight of which one it would be. And then that would suffice. And the only thing I would throw out is any retail establishment that moves in that area could also provide that potential volunteer funding. So just kind of throwing that out there in terms of making this kind of precedented move. I know that we have the two public comments that I could go to now, unless other supervisors would like to supervise along. I see that you have you're unmuted, so would you like to speak?
Thank you, Dave. I have a question for you. Port Hueneme is my district, and they have the Green Mile. And so in this location that we're talking about for Nyland Acres, you're stating multiple locations. Do we know how many that would be if that was the case? If this pilot is not just one, what is the maximum amount of locations that would be able to be opened?
There are 20 parcels in Nyland Acres that are zoned as CPD. So our evaluation would be looking at those 20 parcels and then looking at surrounding land uses or other type of criteria that might have us narrow it down. It could be a block of 3 CPD parcels that are all adjacent to each other. There are certain blocks. It's not just one big block of 20 parcels of CPD. It's a mix along the frontage there of Ventura Boulevard. So we'd be doing that evaluation, but it'd be more than just one parcel.
And so then with that, is there any rules or regulations, just like a liquor store, for how far they have to be from either the community center or housing, childcare, that kind of items?
We would look at sensitive uses and see if there's a rational basis for only determining these parcels in this location versus another parcel in another location. There is residential in the area. There isn't a school, but there could be daycare facilities. So that's part of what staff work would be doing to evaluate what would make sense for the overlay and doing our analysis. And then we'd be coming back through the process, including the Planning Commission, in review of technically of our overlay proposal, and then ultimately to the board.
Thank you. I think that's extremely helpful for our community and for our board members as we vote for this, because it's important to understand what the impact will be. So thank you.
Let's see, do we have other supervisors that want to ask questions before we go to the public members? I'm also would note that we are seeing the area around Nyland Acres, the city of Oxnard, Port Hueneme, all coming in with potentially more retail sales of cannabis. So I don't know, that's going to compete certainly with the amount of tax dollars that will generate from them.
And my comment is not against this. I just want to make sure we understand what the locations are. In fact, we have found that the cannabis shops have really given back to Port Hueneme in so many ways, and it's been extremely beneficial. So I appreciate all that they're doing. I just want to make sure that the locations that are selected are in the right locations. Thank you.
Right. Is the vote of the people, which apparently is a 2/3 vote, would that be countywide or unincorporated county voters only?
It would be countywide.
Oh boy. Okay. So I think we have two speakers, the leaders of this effort, and they are on the phone, and I do want to give them an opportunity to speak. And we have both Mike Barber and also Mary Ann Rooney. I guess, Mike, you may be on the video. Yes, I see you there. If you'd like to unmute yourself, and then please proceed.
So my name is Mike Barber, and I'm a 47-year resident here at Nyland Acres. I am the president of the Mutual Water Company out here since the mid-'80s. And I'm a 40-year member of the El Rio MAC and the chair for the last 10 years. 2008, we started Santa to the Sea and helped distribute over 50,000 toys to needy kids. And this year, we're going to pass the 1,000 scholarship mark for students going to Oxnard College. We started the Nyland Promise to help this community through food pantries, COVID testing, health clinics, and outreach services. As you all know, Nyland Acres is the poorest community in Ventura County, and we lack a lot of services out here. Our people really need help, and since COVID, it's even gotten worse. So we're asking you to approve this feasibility study to help our community. We've been waiting patiently since November of 19 for this to come up before your board, and we just hope that you don't turn your backs on us, and so we can just help this community and our residents and fill them with hope and pride. And I'd like to make one comment that you guys were talking about on the Ventura Boulevard. He's right, there's about 20 parcels that could be eligible for this type of business, but most of them are long established businesses. And when some of these cannabis retailers were walking up and down the street and talking to the owners, nobody was interested in renting to them except maybe 1 or 2 parcels. So it's not like there's going to be a big demand for people coming out there and opening up marijuana shops. So please consider this. I hope that there's a way. I think there's a way to do it without the countywide tax. You guys are the experts, so I'm just helping you. Please help this community. We need as much help as we can get. And this is a good way to bring funds in this community, and it doesn't cost the county or anybody else any money. It's going to be coming in, and it's going to be doing a lot of good for this community. So thank you very much for listening to me.
Thank you, Mr. Barber. And also, thank you so much for the wonderful work you've done in that community, as Supervisor Ramirez said, and the Santa to the Sea and the raising of funds and gathering gifts for the kids, and just incredible work you've done. Do I understand then from the last part of the report from Mr. Ward is you will be happy just to have the ability to have a cannabis retailer in Nyland Acres, and the rest of, whether they volunteer to provide money, that will be something that we or you all have to work on independently, and that works for you?
Yes, if you're asking that question to me, yes, absolutely.
Thank you very much. Yes, I was. And again, thank you. And do any supervisors have any questions of Mr. Barber? Okay. Supervisor Long, I believe you do. And so does Supervisor Ramirez. Let's go to Supervisor Ramirez first.
I don't. I was just
okay.
Mr. Barber. Right. So we'll have comments later.
Okay. And I wanted to respect the fact that it is your district. Supervisor Long.
Yes, thank you, Mike, Marianne. Thank you so much for all that you're doing with the Nyland Promise. I just wanted to ask real quick in regards to security. I've been at some of the cannabis shops in Port Hueneme to understand how that business works, the security, logistics of where the locations are. Were there any conversations on the security? I want to make sure our public safety is connected with this, not just the sales tax.
Well, we would follow the lead of what they're doing in Port Hueneme. They're doing an excellent job over there, and we would mimic their security that they have there. It would be the same.
Okay, great. So I would just ask staff to make sure that they review the ordinances that Port Hueneme has really worked on with our cannabis shops to make sure that we're going through that. We've learned some great lessons, and I want to make sure that we cover that as well. Thank you.
Excuse me for 1 second. There's one thing I failed to mention is that if this goes through, we will be doing
I just genuinely appreciate everything you and Marianne are doing with the Nyland Promise. It really is inspirational for neighborhoods like yours. My question was, you heard it earlier, is the issue of sensitive uses. And I couldn't see in my initial investigation, there's no schools, but are you aware of any issues in terms of sensitive uses nearby the CPD zoned parcels?
No, there's none. There's no schools in Nyland Acres.
All right, thank you.
Thank you. I guess there was a school, right? And it was made into a community center. I know we also have Miss Rooney on, and she is on the telephone, I believe. And Miss Rooney, if you can unmute yourself, we'd like to hear from you. And I'm still seeing that you're muted, Miss Rooney. If you could unmute your phone, is it star 63? Am I right?
Star 6.
Star 6. Thank you. Here she is.
There I am. Hi.
You may have
morning,
more
Chair
than
Parks
one
and
device.
Supervisors. Hi, my name is Marianne
you
Rooney. I'm the other
one off.
co-founder of Nyland Promise, and I want to thank you for your opportunity to speak on this agenda item today. As you will recall, we appeared before the then Board of Supervisors in November of 2019 to discuss a way to improve the disadvantaged and unincorporated community of Nyland Acres to build a community filled with hope and pride. We have been patiently waiting for an item to come back to the board, and here we are today with a recommendation. I have submitted a letter as part of your board packet that outlines the needs and desires of our community. As part of that letter, we included a list of more than 140 people who supported the initiative to move forward with a pilot program. In 2012, Senate Bill 244 identified Nyland Acres as a disadvantaged unincorporated community. The intent of this legislation is to encourage investment in these disadvantaged communities that contribute to regional inequality and infrastructure deficits. Based on this legislation and the great needs in our community, we ask for your help so we can help our community and make generational change. I respectfully recommend that you approve the pilot program and direct staff to prioritize this item in their work plan to complete as quickly as possible and in the most efficient manner. We do not support the option to have a countywide vote on this item, but an option that makes this happen the fastest. I encourage you to take a bold step to help our disadvantaged residents by allowing a legal business to operate in Nyland Acres under such a pilot program. As the most disadvantaged community in the county, we know that this type of investment in our community will make this generational change and develop a better county resident. On behalf of all of the residents in Nyland Acres, we thank you for your consideration in helping raise our community. Thank you.
Thank you, Ms. Rooney. Now we have an opportunity to go back to staff if there are any questions. I know Supervisor Ramirez would also like to speak. Why don't you go ahead, Supervisor Ramirez?
At the appropriate time, I'd like to make a motion to support the feasibility study for the pilot project. And the reasons are that have been very eloquently stated by Mr. Barber and Ms. Rooney about the needs of this very poor community. I think we want to hear from staff, and I'll continue my comments after that. Thank you.
Okay, and I would like to ask staff what that means in terms of the feasibility study, because I know you've already done an assessment, and it sounds like we are ruling out the whole concept of the vote of the people and the rezoning and all of that to the best of our ability, and just go with what the request of the Nyland Promise folks are, which is to simply allow for its use.
Well, Chair Parks, to allow for the use would be either you're creating in the CPD everywhere, countywide, to add a retail cannabis use to our county zoning. And that would mean also evaluating the sales tax on that, whether it would just be stay with regular general sales tax requirements of any retail uses and services, or whether you would seek to have additional tax, a higher tax placed on this particular type of use. So it does start to get a little complicated. What we evaluated really was trying to follow the bones, the skeleton here of what the community was seeking, and propose two paths that would allow for that to occur. One that was the special tax, which requires the 2/3 vote countywide of all of our countywide residents, or the general tax. So I don't think those are exclusive from the zoning that then would allow for the use. I think this is working together based upon the preferences of your board, and that we would then take that and move forward with actually coming up with the full work plan, the budget, the time frame, how that would relate to elections and how a vote would occur. All those details is what I would work on with other representatives from county agencies to pull together what this work plan and time frame would be.
Okay. I know we asked the question, what would it take, to allow for one dispensary and collect a tax? And the answer that I'm hearing is it would take an extraordinary amount of planning department effort and a vote. And I don't have objections because it's not in my district. I certainly have concerns about dispensaries, but it's just there's not an easy way to get there. And to take our planning division's time and even the request to do it urgently. Our planning division is so busy right now with working on the general plan, the housing element, the area plans. There's so putting together the ordinances on the climate change, and there's so much on their plate right now. I'm just thinking we have done a lot for Nyland Acres, and I'd be happy to do more, but to go through all these machinations, and what you get in the end is a marijuana dispensary that isn't required to provide funds to the community. That's the bottom line. So I have a lot of concerns with moving forward and thinking that we can have a better, more healthier use in that community and still have something that supports the community there. So I'm not in favor of the motion. Other supervisors? Okay.
I'll continue.
Yes, I just have a concern in regards to now opening this up to the entire Ventura County. And there is no way to keep this just into this one location?
Supervisor Long, there is. That would be the overlay zone. So what I was trying to do in the overarching presentation was to explain the tools by which we could achieve the community's desire and fit it into our regulation framework of the county. And I think there is an ability to do an overlay zone specific to Nyland Acres to analyze which parcels within that overlay would be appropriate. And then the zoning standards and regulations for a cannabis retail operator. And that's what we would design. And then we'd have to decide, is it ministerial or discretionary? And those are all details we can work out. And then the bigger aspect, though, is still the countywide vote, whether it's a special tax or a general tax. And I think this would all work together as a package that you would need to direct staff and to be incorporated into our work plan to do that. I think Chair Parks is correct. There is a lot on the planning division's plate, and we are coming to your board. This is my first opportunity as director to give you a perspective of what the next 2 years is going to be looking like. And if this is a component, then we need to fit that in to our work plan and prepare for that. But you would be able to designate this just for Nyland using the overlay tool.
Okay, I appreciate that because I understand the overlays to me would be a better approach. So thank you.
Yeah, it also seems like it would be several hundred thousands of dollars in planning and going out to a vote of the people too. That's why I'm just thinking, and it's an iffy proposition in the end because there's no guarantee. There's no requirement that they voluntarily give money to that community. I just feel like there are better ways of going about it. I've had my say. With that, Supervisor Levere and then Supervisor Ramirez.
Well, actually, Supervisor Ramirez, did you want to finish your comments on the motion? I'm happy to go after.
Well, I do want to say that Nyland is unique and has had many challenges. And here is a group of people really with total, it seems like very, sorry about the dogs, very strong support. Let me just go ahead, Supervisor Levere. I'll be right back. I got to address someone at the door. I'll be right back.
Okay. Mr. Ward, one question I had was with, CPD zones typically require a planned development permit. And so in this scenario, would we be requiring that along with a future zoning clearance or CUP? Or is that something we're going to be kind of figuring out during the work plan process?
Supervisor Levere, we'd be coming up with what is the appropriate permit path. whether that's a conditional use permit would be the discretionary, which would allow you to add more conditions more specific to the use if you felt that was appropriate. The ministerial path would be more straightforward. Here are the standards. You meet all the standards, then you would be provided a zone clearance. So either path could work. One gives you more oversight if that's appropriate for the discretionary review, although it does take longer to process than a zone clearance application. And we would either look to your guidance as a board on what preference you have, or you could direct us to study that and look at the various communities across the state who've come up with different programs, and for us to analyze what seemed more appropriate based upon an analysis of other communities and their zoning rules and permit processes.
And then, if we were going through the overlay route, which I think we all agree would be the better way to proceed, we have to make the finding. I think it's a rational, factual basis. How difficult of a finding is that to make? Is the fact that they're a disadvantaged community, does that satisfy that finding? To put the overlay zone in that community? That might be a Jeff Barnes question.
If I may, this is Michael Walker. I'll try to pinch hit for Jeff on this question. That is something that would have to be evaluated during the planning department's workup of the matter to see what the basis would be, the factual basis would be to support that sort of finding. So I think it's premature to answer that question today, but it is something that would have to be addressed at the time the item comes back to your board, or your board to make a decision to approve the overlay zone.
Okay, and any other questions, Supervisor Levier?
No, thank you.
Okay, and then Supervisor Ramirez.
Just one more question. Mr. Ward, are you, Mr. Walker and Mr. Ward, are you indicating there would, under any circumstances, all circumstances, have to be a vote?
With respect to the tax, there would have to be a vote if you were going to tax the operation to any extent.
To any extent. And it couldn't just, it would have to be countywide?
That is correct.
Well, I do want to support this community. It is, I don't believe any other community in our county has had this kind of an effort, sought this kind of support. We know that this industry, which is starting to thrive under even difficult circumstances, is just something we all have to get used to, get out of our old way of thinking about it. It is, to me, it's sort of like prohibition. Now you can certainly go just about anywhere and buy what was prohibited previously, and in moderation is not a problem. And I know that's not what my colleagues here are talking about, but just it has been very beneficial to the city of Port Hueneme. I believe it will be beneficial, and I'm speaking financially, to the city of Oxnard. Of course, we have to be concerned about how things are regulated and the security, as Supervisor Long mentioned. I really would like to see something come forward in terms of feasibility. I recognize that there's some timing issues, some staff capacity issues, but I do feel like I have to support it. And so I will make the motion, and I will ask my colleagues to join, but I understand what some of these difficulties are.
I'll second the motion, and I agree with the comments made by Supervisor Ramirez.
Yeah. And I'm just, again, I'm thinking this could cost $250,000, and to get what might only be, $10,000, in tax from the sales of one store, which might even be a lot less than 10,000. So it just seems like we're going through all these machinations, like I said, spending hundreds of thousands of dollars. So I'd be much more inclined to just give some money to Nyland to help their community. We give over $100,000 for each Boys and Girls Club in the unincorporated area. I mean, we do that every year. I mean, if there's a way that we can actually support this community without having to tie up our planning department and expend so much money all to get a marijuana dispensary in this community. That's my thought. So
Supervisor Parks, if you'd like to make that a substitute motion, I'll support it.
I would ask that you do bring that back, and I would definitely support that. It's not on the agenda, but I would definitely support that. Like I've said, we've given money to the Boys and Girls Club, and you have the Nyland Community Center that's doing such great work. So I would definitely consider that. It's not a gift of public funds because it's actually, going for a true assistance to a community. So that's my thought, and I would definitely encourage you to come forward with that if we can do that instead of this.
Madam Chair, can I just follow up on that? Because it's my I thought Mr. Barber had said that they were prepared to move forward with this without moving for the special tax and the elections associated with that.
Yes, I did hear them say that. And then you're again, and they're just looking at, let us have the dispensary in Nyland Acres and we'll work out something, hopefully, even though we have no say on who the retailer will be, that they'll give us some money. And I'm just saying, hey, I can find you a direct path to money, and it's not going through this kind of a wish that, you can have this incredible amount of work done and end up with a dispensary that will give you money. That to me just doesn't seem like the most direct path. And it ties up our planning department needlessly, I think.
I appreciate that, Supervisor Parks. I do agree with the Supervisor Ramirez in supporting that community and all this going on. But in the vision of looking at planning, I think that it's important that we understand this, especially with the rules and regulations that have been changing in the state. And that based on the opportunity that Port Hueneme and has done, I can only see it as a positive for our community. And so thank you. I just want to make sure I supported Supervisor Ramirez.
Okay, and Supervisor Ramirez, this doesn't commit us, I don't believe, to funding the at this point. Is that correct? This just brings it back so staff can give us more specifics on the costs. We don't have projections on how much all of this is going to cost, how much time it's going to take. I think they'll come back in February. I think it was February 23rd for that.
Yes, Chair Parks, that would be February 23rd. So we would try to outline what the total cost would be, but the tax component would be part of that. So if you're thinking general tax or special tax, and you can provide your thought on preference one versus the other, I understand the direction for an overlay zone and the zoning rules that would go along with that. So I'm clear on that part. I'm not so much on the special tax or general tax.
Right.
Where you're asking us to show you scenarios for both.
And as I'm hearing, the Nyland Promise folks are saying don't bother with the tax. And indeed, it will cost a significant amount of money to go on the ballot and be voted on, whether it's 50% or 2/3. It's still going to cost us hundreds of thousands of dollars, likely to put it on the ballot countywide. When in fact, there's no requirement for that fund to be used in that community. Certainly, it's an opportunity for the county to bring in some funds, but I would think that I can't imagine the sales of this one dispensary, if they get one in Nyland Acres, would ever be worth the amount of money that we're going to spend in the election. I mean, you think about how much the percentage of sales tax that we would get to ever reach the amount of money we spent in that election for this one dispensary. It just doesn't seem feasible. But I would definitely entertain instead directing staff to come back with, and Supervisor Ramirez to come back with a motion to support funding the community center there. With that, Supervisor Ramirez, I think it's up to you on the final closing of your motion. And Supervisor, I think Huber also wanted to comment. Supervisor Huber, why don't you go ahead and then we'll go to Supervisor Ramirez.
It's been like a ping pong ball going. I want a clarification of the motion before we vote on it.
Supervisor Ramirez, the motion?
Well, my motion was to support a feasibility study of the pilot program, which would include the costs and the complications. And I think I recognize what you're saying, Chair Parks and others, but I would like to see this go forward. And perhaps the timing could be adjusted so it's not such a burden on planning staff. But my motion is to allow the feasibility study to be done.
Okay. Supervisor Huber, did you have any comments on the motion?
Oh.
Okay, then could we have the roll call, please?
Supervisor LeVere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
No.
Supervisor Ramirez.
Yes.
Chair Parks.
No. Okay, that motion does pass, and we'll be hearing back roughly February 23rd or so, as I understand, on some information on cost implications and the amount of time that staff will have to expend, and we can move on from there. Thank you very much, and again, very much appreciate the leadership in that community to assist those in need. Very much appreciated. I believe at this time we can go back into our closed session and then come back at 1:30 when we will have our board comments, including some closing and honors, and then also our CEO and public comments. So with that, we will go into our closed session and then from there back into the public session at 1:30. And so we are at recess now. Thank you. Long, I'm going to go to you first.
Okay, we're ready.
Okay, good afternoon. We are back from our closed session on our February 9th, 2021 Board of Supervisors meeting. And we're going to go to our board comments now, and then I'll go through the supervisors. I know we have a couple of people we want to close in honor of that are very close to us. And so with that, I'm going to ask Supervisor Long to go first, and then I will follow her with another closing in honor. So Supervisor Long, would you like to go forward?
Yes, thank you so much. I would like to make my comments more in the adjourn and memories with the sad end of COVID. We had Rudy, sorry, it chokes me up sometimes. Rudy Gonzalez is such a wonderful man, and he passed away on January 25th while in the hospital suffering from COVID-19 after being admitted on January 1st. He worked for Ventura County for 35 years and 4 months, beginning on September 16th, 1985, with the GSA as a GSA maintenance worker 2. He moved to Public Works and became a tree trimmer 1 with the road and transportation, and Rudy was promoted to tree trimmer 2 and then became a Public Works maintenance worker 3. Rudy's sister gave us some very kind notes from the family to say thank you for adjourning in memory. Rudy was one of 12 kids and took care of his parents, his family. He was a very generous man that had shown so much empathy for anyone who was down on their luck, and he was a huge animal lover and just very touching for our county staff. They had so many stories to share, and I know they would love to talk about them. But really, we all will miss Rudy. He was a good friend, and he all shared a brotherhood. Rudy was a big heart and a very kind and thoughtful man. He was very generous and always looking for ways to help this team. And with this real brotherhood exhibited by Rudy, and has truly appreciated his opportunity in working with his buddies and around the county of Ventura. And so along with this dedication to lead the less motivated, Rudy did an outstanding job to support the success of our O&M team, and Rudy will truly be missed. I've asked Dave Fleisch if he'd like to say a few words, and I think he is on today. I know that Rudy's family is watching as well. Good afternoon, David.
Good afternoon, Supervisor, and thank you for this opportunity. I appreciate your kind words. Rudy was a special employee for us. He, as you stated, was with the county for over 35 years. You could always tell if there was laughter coming from one of the crew rooms, it was probably because of some joke that Rudy told. He had a really great sense of humor, and he truly was very generous and very thoughtful. Just some examples. We had a time last week where the crew members were able to share about their memories of Rudy, and several things came up. One, he would just bring large bags of oranges into the crew to feed them from the trees that he had. Also, whenever we were working a big project, he would go ahead of time to Taco Bell and bring burritos for the entire crew, just to give everybody a little something to snack on during the day. He liked sports, as you mentioned, and he went to a Dodgers game with some coworkers. And after the game one time, the next day, one of the coworkers came in and found a bunch of his stuff left on his chair. Apparently, that coworker had a little too much cerveza on his way at the game and left his belongings behind. Rudy noticed and brought them back for him so he didn't lose them. And he was always doing things like that for people. He carpooled, and one of the coworkers, they had to stop and pick up his son after the coworker's son after playing sports. And so Rudy often volunteered to pick him up if the coworker couldn't make it. And in fact, one day brought the son several hockey sticks because he knew he played hockey. And those are all just very indicative things of how Rudy was. He just had a penchant for making everybody smile and, making the work out in the field, which sometimes is tough and very arduous, just more palatable just by his presence.
Thank you. And it's just hard to lose one of our own, no matter if it's a family member or friend at work. And so our hearts go out to Rudy Gonzalez's family, and thank you very much. With that, go ahead, Linda, Supervisor Parks.
Yes, thank you, Supervisor Long. And I'd also like to do some closing in honor, and then we'll go back to our regular type of board comments. But I just thought how important it is to take this time out to recognize. And our county family did lose Mr. Gonzalez, and also seeing how COVID can really destroy families, and so we are all very sorry to see that we lost him to COVID. And I would also ask that we close in honor an individual who just died this Sunday, and that is Ricardo Ramirez. He is the loved brother of Supervisor Carmen Ramirez. He is a wonderful, generous, kind, and loving brother who will always be remembered like that. A father, a grandfather, and a friend. And he too died of COVID-19. And I know Supervisor Ramirez is heartbroken, and it was only really a matter of hours ago that we lost him. And I know I admire Supervisor Ramirez that she wants to be here for this board meeting. It's important to her. And I think it also is important for all of us because her brother lived an inspiring life and had many friends and loved ones and family members who loved him. And we don't want his passing to go unnoticed because not only was he an incredible man, we want to make sure that we don't lose any more individuals to COVID. And that is a really powerful message that I think Supervisor Ramirez is bringing to us by being here today. And we, as a board and as a county family, our hearts go out to you, Carmen. We are so sorry for your loss. I didn't have an opportunity to meet your brother. He just seems like a wonderful human being, and I want to turn it over to you. Certainly someone that will be forever missed.
Thank you, Chair Parks. I'm going to try to get through this. It has been very recent. He actually passed away Saturday, a community memorial. And really appreciate all the things you said. My brother became ill about 3 weeks ago, and we had so many hopes that he would survive this. It really seemed that he would, but that's what happens with this virus. You have your hopes up. You've done everything you think is right, but you still are attacked by it. And I want to also send my condolences to the Gonzalez family. We read in the papers, in the news about the vast, terrible numbers of people who've lost loved ones. And I was in that group thinking, yes, I'm afraid of it, but it's not going to touch my family. We're going to be safe. We're going to be careful. But the nightmare came to us, and I won't go into all of the nightmarish things, but just knowing the terror of fearing that your loved one is suffering, wants to be with you, but nothing works, and then he slips away. My brother Ricardo, I was a child when he was born. He was born at home in California, and all of the other children were there. We knew my father came out and announced after my mother gave birth, "You have a brother, another brother." I remember it very vividly because my father cooked dinner that night, which was usually what my mother always did. And we were a very close family. There were 7 siblings. We always talk about being 7, and now we're 6. He loved his children, his grandchildren so much. He did so much for them. He never failed them. What I've experienced, I don't want anybody to experience ever, ever again. But the odds are against that. So please, everyone, take care of each other. You just don't know whether it's COVID or something else that will take your loved one away. And we have to appreciate every minute we have. But we get complacent and we think we're immortal. We're not. We're here for a very precious time, and we have to recognize that. And I thank you for this opportunity to recognize my wonderful brother.
Absolutely. And I know you also said that he was 40 years, he was electrician, hardworking electrician all over California. And he was also an Army vet, a 20-year Army vet. And I know you sent a photo of him on a boat. He wanted to sail to Hawaii, you said, right?
Yes, that was his dream. And he was almost going to be able to do that. He just purchased a wonderful boat, making it seaworthy. And that was his great dream. So we hope that in the next life, he's sailing to Hawaii, enjoying the ocean that he loved.
That's beautiful. Thank you, Supervisor Ramirez.
Thank you for this opportunity.
Yes. I would also like to close and honor someone else who just died. And I think This is also really difficult, someone that I knew, and particularly someone our county benefited from. And this is Georgia Perry. Georgia just lost her battle with cancer. Her husband, Dennis Perry, was instrumental in working to get Growing Works up and going. Georgia, you look at her power, even with the horrible disease she had, but she was such a strong advocate for people with mental illness. And she had so much love for family and did everything she could to help our mental health system, because she had her young son suffer from mental illness and die, unfortunately, too young. And so when I think of Georgia, I think of the love that she has for her children, for her son, and that she is with him now. And that gives me some solace. Her husband, Dennis Perry, found her to be the light of his life, could tell her anything, and just was his partner. So I know when you lose someone, how it can really crush you. And we wish the family of Georgia Perry, all the people who we are closing in honor of, we wish them the strength and solace in the fact that they had the benefit of having these individuals with them for the periods that we did. So with that, we will close in honor of these three individuals, Rudy, Ricardo, and Georgia. And I will now go back to through our Board of Supervisors Board of Comments, so we can also talk about the other things that we do during our Board of Comments. So with that, I will go to our District 1 Supervisor, Supervisor Matt Levier.
Thank you, Madam Chair. It's easy to let COVID seem like it's not close, but when you lose a member of the county family and you see one of your colleagues lose a close family member, it really hits home. And I hope it hits home to everybody else like it hit home to me, about the fact that there's so much we still need to be doing to keep ourselves safe and our community safe. So I just want to offer my thoughts and prayers to Carmen and the entire county family, and to Mr. Perry. It's just really hard to hear these reports. On another topic, obviously not as important as that which we just discussed, I wanted to bring everybody up to speed on Gold Coast transportation. It's one of the committees I sit on, the board of directors. And as many of you might know, Gold Coast waived all transit fees last year and through to currently. But in looking at long-term planning and at looking at their budget moving forward, they're working with some other regional transit coordinators. And I wanted to let the public know that right now the plan is to consider re-implementing fees in April. So we're obviously we're happy to take customer feedback, but in order for the Gold Coast to continue expanding their routes and their times and to kind of keep their budget afloat, I wanted to bring the public up to speed that that's something that we're considering coming this April. And that's it. Thank you, Madam Chair.
Thank you, Supervisor Levier. And now we'll go back to Supervisor Long for your board comments.
Hi, thank you. I'm continuing to advocate for our county on the state and federal level in regards to COVID, administration of justice, and other items. You're right, Supervisor Levier, there are more things going on than just COVID, and sometimes we have to make sure our community knows about those items. So I do want to reiterate our EDC collaborative to go there and get information if you're a business owner on big items of grants associated with the COVID-19, and that you can call 805-409-9159 in English, or in Spanish is 309-5874. It's a no-cost consulting for our businesses. There is a call team as a chair of that committee. I want to make sure that everyone knows that all these grants are available for our businesses. And then also, just to adjourn in memory, also I'm on the Association of Water Agencies, and we have lost a Pete Fellini, who just such a strong member of our AWA, spinning back to our founding days. He served on our board of directors for many years and chaired the early AWA Small Water Systems Committee. And all of you know how important water is to our cities, our agriculture. And just something that Pete always told us was that he believed in hard working and playing harder and having fun and making sure we're all in it together. And Pete just was that type of guy. He was an absolute good guy. He forever kept his smile in his heart, and he was great. He'll be greatly missed. He is survived by his wife of 50 years. That alone is an amazing feat, with Patty and his children, Danica and Mark and his grandchildren. And so I just wish him and his family and the others that are on the journal list submitted to the clerk of the board. So thank you so much. And then again, staff, thank you so much for opening up the vaccines for the 65 plus. It's really just made so many people's day today. Thank you.
Thank you, Supervisor Long. And yes, I think we're all hearing cheers from people who, and we're able to actually get appointments this morning too, which was nice to see that, because we know the supply is limited. So we do thank people for their patience. Supervisor Hubert, would you like to do your comments now?
I would, thank you. Thank you, Madam Chair. I would like to start by offering my sincerest condolences to Supervisor Ramirez and her family on the loss of her brother, Ricardo Ramirez, during this difficult time. My thoughts and prayers are with you all. This past Saturday, February the 6th, marked the 110th anniversary of President Ronald Reagan's birth. Due to the pandemic, a virtual celebration was held this year. A belated happy birthday to our President Ronald Reagan. President Reagan's optimism was, to me, his defining trait. He had a wonderful ability to look forward with hope. During these difficult times, I'd like to take a page from Mr. Reagan's book and look forward to getting our residents healthy and our economy up and running again. And I'd like to look forward to visiting Reagan's Presidential Library in person once again. In closing, I'd like to adjourn in memory of the residents cited on this list to the clerk of the board. Thank you very much.
Thank you. Thank you, Supervisor Huber. For my comments, I just wanted to say happy birthday, Mike Powers. You don't look old at all. And with that, I will ask Mr. Powers to give us his comment.
Thank you. Not what my boys say, but thank you, Chair Parks. I owe you one. They're piling up. Well, thank you. I just take just a moment, and again, so really thinking about Supervisor Ramirez, Carmen, and just holding her close in our thoughts and prayers and to our hearts today, and thank her for sharing Ricardo's life with us and for reminding us of the importance of valuing each of our family members, our friends, and our coworkers, and just to really cherish the time we have with each other and how important that is. And to Rudy Gonzalez's family, just thank you. Our county family culture is so important to us, and we thank your family for sharing Rudy with our county family for 35 years, and you can hear what a difference he made in the lives of our workforce here at the county and the important work that he did. So just thank you to everyone, and thank you to your board today for your support. Thank you.
Okay, with that, let's now, as I understand it, we go to public comments, and there is one individual who has submitted a written one that our clerk is going to read. So I'll go now to our public comment item, and if we could have our clerk read the individual's comment.
Good afternoon, Chair Parks, members of the board, and CEO Powers. This is an email from Annika Forrester. It says, I have tried fruitlessly for the last several weeks to get clarifications from county staff regarding eligibility of in-home healthcare and in-home supportive services workers to receive the vaccination as specified under Phase 1A Tier 2. It is clear that those caregivers who work for agencies, facilities, and institutions, including IHSS, are eligible. However, the fact is that these institutions employed caregivers representatives, the minority of people providing such in-home care and services in our county. There is far greater population of in-home care providers serving the much larger population of medically vulnerable and middle patients. IHSS only supports the care of the lowest income patients, and long-term care facilities really only serve the population of the highest income patients, residents that can afford the $5,000 a month fees to live in such institutions. For the vast majority of middle-class families who have in-home care needs, the invisible workforce of independent in-home caregivers are currently serving their needs, yet they are routinely refused vaccinations by the county workers screening vaccine seekers at the county vaccination sites. The main reason they are rejected is because they cannot manifest the very rigid and institution-centric documentation required by the county. Because they're medically vulnerable and in the need of care, employers are simply private individuals. They cannot issue photo ID. Often, they pay the caregivers with personal checks or cash and thus cannot provide a pay stub as required by the county. Most caregivers have no license, and while they may be able to provide a letter from their employer, client, patient, the county requires a letterhead. And unfortunately, that is at the 250-word limit for this email.
Thank you. Thank you for reading that. And again, it is something that our county did focus on, having vaccinations available to our most vulnerable, those 75 and older. And today we were able to open it up to 65 and older. And we're just really doing all we can to get more supply of vaccines so we can get it in the arms of individuals as soon as possible. With that, we have a 3 p.m. Public hearing. So right now we're going to go and recess and come back for our 3 p.m. hearing. And I look forward to seeing you all then. Good afternoon. I'm calling back to order our Board of Supervisors meeting of February 9th, 2021. And we are now going to our public hearing. And I wanted to make sure that people know that this hearing on our housing element will be broadcast on Spanish Facebook. So you can go to the county's Spanish Facebook page. And we will also have Spanish and Mixteco interpreters available for the public speakers when they speak. So I wanted to make sure that was put out there. I know we have several staff members from our resource management agency and our planning department to present our public hearing. So I'll go ahead and open that public hearing. And we will be able to now review the state mandated update of our housing element. Now, I believe Jennifer Butler, will you be starting us off?
Good afternoon, Chair Parks, Mr. Powers, member of the board. For the record, I'm not Jennifer Butler, I'm Tricia Meyer.
Okay, hello, Tricia Meyer.
I'm the Long Range Planning Manager in the Resource Management Agency's Planning Division. I was going to go ahead and just repeat your statement about the Spanish and Mixteco translation in Spanish for those who might be listening, if that's okay, Chair Parks.
Please, thank you.
Esta sesión se transmite en la página de Facebook en español del condado y hay intérpretes de español y mixteco disponibles para comentarios públicos. So the last item before you today is the county's draft housing element. A lot of effort goes into a long-range planning document like this, I'm sure you can imagine. So I'd like to go ahead by starting and introducing our housing element update team so that you know who's speaking and who's available for questions. Our first presenter will be Chelsea Payne. Chelsea is Director of Urban Design and Planning for Ascent Environmental. That's the consulting firm hired to assist us with the housing element. She's joining us remotely from the Sacramento region today. Then we have Jennifer Butler. Jennifer's the project manager for this project. She's a senior planner in the planning division and will present the second half of the presentation. Also with us in the meeting today to help answer any questions are Dave Ward, our planning director, and Owen Deutsch, an assistant planner on our team who compiled much of the data for the draft housing element. In addition, we've asked Christine Madden from the county's Community Development Division to join us for any questions you may have related to programs her department oversees that have also been incorporated into our housing element. Before we begin, I wanted to point out two minor errors in Table 4 of your board letter, which is the housing inventory summary on page 12. The numbers to be corrected reflect the above moderate income housing units to be accommodated in the Bell Canyon and Lake Sherwood communities. They should read as 63 and 76 units respectively. This means that the number of inventory sites for above moderate income households is 525 units, not 535 as shown in Table 4 of your board letter, making the total inventory 2,469 units. This information is accurately reflected in the draft housing element, which is Exhibit 1 of your board letter. In addition, your board received about 10 comment letters yesterday, many of which requested revisions to the draft housing element. We fully intend to give these requests the time and thought they deserve by evaluating them and incorporating revisions to the draft document where we can. Many of them were helpful suggestions on ways to amplify our technical discussion in the draft housing element on constraints to residential development and the specific needs of special needs populations. We welcome this input. It actually makes our document a much better document. Others were new program requests or requests for revisions to proposed policies and programs. One of these program requests came to us more than a week ago, giving us time to integrate it into revisions to Program E, which is for a farm worker housing study. Jennifer will cover this later in the presentation. The other program requests will require further evaluation by staff before we submit the draft housing element to HCD. I do want to emphasize, though, that this is just a preliminary draft of the housing element. There will be more public hearings to review the new language and revisions when this item comes back to the Planning Commission and to your board in summer and fall. We expect this to be an iterative process with public input continuing through to the end. With that, I'll go ahead and I want to go ahead and briefly share with you what we're going to cover in today's hearing. Then I'll hand it over to Chelsea. Chelsea is going to walk you through an overview of the housing element, then cover the county's regional housing needs allocation targets. Jennifer will then jump in to summarize the residential sites inventory and the proposed housing element programs. And we'll end with our project schedule and next steps and then take your questions. So with that, I'll go ahead and let Chelsea get started.
Thank you.
All right, thank you very much, Tricia. And here you have the agenda slide that Tricia just reviewed. My name is Chelsea Payne. I'm the Director of Urban Design and Planning with Ascent, and I work on housing elements across the state. And I've been assisting your staff during the preparation of this housing element update. It's really been a staff-led effort, but I've been here in a peer review role and an advisory role, and I've been really just enjoying working closely with your staff on this. I'm going to start by reviewing some of the new state laws. There have been a lot of new state laws that have passed in recent years affecting housing elements. You'll see several of these requirements reflected in the new programs in the draft housing element that Jennifer is going to discuss later in the presentation. But first to start, Assembly Bill 686. This bill requires all public agencies to administer all programs and activities relating to housing in a manner that affirmatively furthers fair housing. This means taking actions to overcome patterns of segregation, address disparities in housing needs and access to opportunity, and foster inclusive communities. Housing elements now have to include an assessment of fair housing practices, examine the relationship of housing sites to areas of high opportunity, and include specific actions to affirmatively further fair housing. The new Fair Housing Assessment is contained in Chapter 2 of this draft housing element, and it incorporates a lot of work that was done through the Consolidated Plan and Analysis of Impediments to Fair Housing Choice report that was conducted by the Community Development Division in 2020. State guidance is still pending on this requirement, and we do expect that this analysis is going to evolve as we work with the state during their review process. There are several new requirements related to the sites inventory. The biggest changes really came with AB 1397. This bill requires additional analysis of the sites that are included in your housing element sites inventory. Particularly, more analysis is needed to demonstrate the appropriateness of your non-vacant sites and your infrastructure capacity for your sites. Also, non-vacant sites that have been included in at least one previous housing element or vacant sites included in 2 previous housing elements can only continue to be counted towards your lower income need if they are subject to a program to allow affordable housing by right. Those were the biggest changes really affecting the sites inventory this round. Senate Bill 166 is an important law to be familiar with. This bill amended the no net loss rule. This rule requires jurisdictions to maintain sufficient sites to accommodate the lower and moderate income RHNA, Regional Housing Needs Allocation, throughout the entire planning period. So not only do you have to prepare your housing element right now, showing that you have adequate sites, but you need to maintain those adequate sites throughout the entire 8 years. If a site is included in your lower income inventory and it's developed with either fewer units or at a different income level. So you have a site identified for lower income in your housing element and you get a market rate development. In approving that project, you would need to determine that the remaining sites in your inventory are adequate to accommodate the remaining housing target, the remaining RHNA, or you would need to identify and make available a replacement site within 180 days. So what this requirement really means is it's important to make sure that you have a surplus capacity to meet your lower and moderate income regional housing needs allocation. There have been several changes to state law regarding accessory dwelling units. AB 671 specifically relates to accessory dwelling units in housing element. This bill requires local governments to include in housing elements plans to incentivize and encourage affordable ADU rentals. Assembly Bill 101 relates to homeless shelters. This requires that a low barrier navigation center be a use that's allowed by right in any mixed use zones or any non-residential zones that allow for multifamily uses. And a low barrier navigation center, it's a type of homeless shelter that has lower barriers to entry, and it's focused on moving people into permanent housing. And then finally, AB 879, this bill created some new reporting requirements for your annual progress reports, and also requires that your analysis of governmental constraints in the housing element look at any locally adopted ordinances that directly impact the cost and supply of housing. So it casts a really broad net on what you have to look at in your constraints analysis. The bill also added new requirements for the non-governmental constraints analysis. We have to look at any requests to develop housing at densities below those anticipated. You have to look at the length of time between when a project is approved and when building permits are pulled. And then you have to describe local efforts to remove these non-governmental constraints. So there are a lot of new requirements that are reflected in this housing element, and Jennifer's going to talk about those in the program section as well. So what is the housing element? Every city and county in California is required to have a housing element. The housing element is a section of the county's general plan. It looks at housing needs and issues in the county and is a policy document that contains the goals, policies, and programs that the county uses to guide actions related to housing development. There are very detailed requirements in state law for what must be addressed in the housing element. Unlike other sections of the general plan, the housing element is reviewed and certified by the state for compliance with state law. The state mandated due date for the county's housing element is October of 2021. Unlike the rest of the general plan, which typically has a 20 or plus year planning horizon and is typically updated every 10 to 15 years, jurisdictions are required to update the housing element every 8 years according to a state mandated schedule. So for this reason, housing elements are almost always updated on a separate timeline from the rest of the general plan. And in fact, on the 60 or more housing elements that I've worked on around the state, I don't think that there's been one instance where the housing element was actually updated concurrent with the general plan. It's almost always on its own timeline. However, there is a requirement to look at consistency between the housing element and the other general plan elements, and planning staff evaluated consistency with the general plan when preparing this draft housing element. More formal general plan consistency findings will be required when the final housing element goes to the Planning Commission and board for adoption in the fall. While the housing element is focused on meeting the needs of county residents, it's also the county's plan for how it will accommodate its fair share of the greater regional housing need. So what's covered in the housing element? There are several sections in this element. First, the needs assessment. We start off by conducting an assessment of housing needs. We look at demographic, socioeconomic market data to understand what the community's housing issues are. This includes looking at the needs of special needs groups that are identified in state law, like seniors and farm workers. We also describe the projected fair share of the regional housing need, which I'll talk about in a minute. And then we conduct a detailed analysis of the available sites. This includes looking at the realistic capacity for new housing. We look at any pending projects and any vacant and underutilized sites that are zoned for residential development, and we describe what the capacity is on those sites. We compare the capacity on sites to our housing targets that are called the RENA to determine whether or not we have enough land to meet our projected housing needs. The housing element also contains an analysis of potential constraints to housing, including governmental constraints. So we look at permit processing procedures, fees, development standards, zoning restrictions, anything that's a potential barrier to housing production. And then non-governmental constraints, availability of financing, land and construction costs, and community attitudes that could result in reduced density. The fair housing assessment I mentioned is a new requirement. And in this section, we're required to identify barriers to equal housing opportunities. We look at the relationship between your sites inventory and areas of opportunity. Make sure, are we identifying sites for lower income housing in our higher opportunity areas? We conduct an evaluation of the current housing element implementation programs to determine what's working, what's not, where are the gaps. And then we use that evaluation and all of the input we receive from the community engagement process, from stakeholders and decision makers to update the goals, policies, and implementation programs. This shows how the draft 2021 to 2029 housing element is organized. You'll notice that the draft housing element uses a format that's different from the other 2040 general plan elements. It's been formatted in a way to facilitate review by the public and decision makers and by the state. Staff has made a user-friendly version of the document that incorporates all of the various components of the housing element in both the policy document and the background report, all into one document. Once staff receives edits from the state, a legislative version of the housing element will be made available it'll be integrated into the general plan format. But this is how the current draft housing element is organized. Chapter 1 is the introduction, describes the general plan consistency review and the details of the community engagement effort. Chapter 2, the community profile, contains the housing needs assessment that I mentioned. Chapter 3, housing regulations and potential constraints, is the required governmental and non-governmental constraints analysis. Chapter 4, the resource inventory, it describes the RHNA, the county housing target, and the inventory of land that's available for residential development. It also describes the funding available to support housing programs. Chapter 5 is the policy document. It contains the goals, policies, and implementation programs. The general plan identified cross-cutting themes of environmental justice and healthy communities, and those themes are identified in the draft housing element with EJ and HC icons. Chapter 6 contains a glossary of housing terms and acronyms, and then the appendices to the housing element include a detailed list of the sites identified in Chapter 4, the evaluation of the previous housing element programs, and a summary of all of the public outreach conducted through January 2021. The housing element focuses a lot on providing affordable housing, particularly to low, very low, and extremely low income households. So what is affordable housing? The state and federal governments establish income limits that are shown here. These are the income limits for 2020 for Ventura County. A low-income household for Ventura County is one that's earning less than 80% of the area median income, or about $90,000 for a family of 4 in the county. $2,259 would be considered an affordable monthly rent for a low-income household at 80%. A very low-income household is one earning 50% or less of the area median income, or about $56,000 a year for a family of 4. And an affordable rent would be considered about $1,400. On to the next slide. In Ventura County as a whole, including the cities, the median household income, according to census data, is nearly $82,000, and the median home sale price is about $583,000. In the unincorporated county, however, the median household income is about $8,000 lower than the county as a whole. But the median home sale price is significantly higher at $769,000. So this shows a mismatch in affordability, particularly in the unincorporated county. The average asking rent for a 2-bedroom housing unit in Ventura County is over $2,000. Housing is considered affordable when you're paying no more than 30% of your income on housing. Renters would need to earn nearly $6,800 per month, or 3 times the minimum wage, to afford the average rent for a 2-bedroom unit. So you can see here some of the typical wages for lower wage jobs and how that compares to the amount needed to afford the average rents. The county has a high homeownership rate, with 68% of households owning their home in Ventura County, as compared to 54% statewide. Renters are more likely to be cost burdened. Cost burden is defined as paying more than 30% of income on housing. 54% of renter households are overpaying for housing in the county, and 32% of homeowners are overpaying. Next, I'm going to talk about the regional housing needs allocation. As I mentioned earlier in the first slide, the housing element is the county's plan for meeting its fair share of the regional housing need. The process of determining the county's fair share starts at the state level, with the Department of Housing and Community Development calculating the overall future housing needs for each region of the state over the time frame of the housing element. The regional councils of government are then required to develop a methodology for distributing the regional housing needs among all the cities and counties in the region. The Southern California Association of Governments, or SCAG, is the regional government for Ventura County. And as a region, has an allocation of about 1.3 million housing units. Unincorporated Ventura County is responsible for providing land for 1,259 of those units. And as of this time, the RHNA is still in draft mode, but we will be receiving the final RHNA allocation. This table shows the RHNA for each jurisdiction in Ventura County, all the cities and the unincorporated county, and it's broken down by the income levels shown here. Ventura County as a whole received a target of 24,398 housing units in the draft allocation. You can see that total here in the bottom right-hand corner. The unincorporated areas received about 5% of the countywide RHNA. This is reflective of the countywide policies around directing growth to the cities. There are a lot of constraints on development in the unincorporated county, and the RHNA is reflective of this. In just a minute, Jennifer is going to talk about the county's strategy for meeting the RHNA. And as she'll describe, we're not currently seeing a need to rezone land to meet the RHNA. We've identified in this draft housing element adequate sites for meeting the housing target. Before I hand it over to Jennifer, I want to describe an underlying assumption about how density relates to affordability in our sites inventory. The basic assumption that's written into state law is that the higher the density, the more affordable the housing will be. So land that's zoned for new single-family homes is assumed to meet the above moderate income RHNA. Land that's zoned for attached housing like townhomes is assumed to meet the moderate income need, and land zoned for apartments, specifically allowing 20 units per acre, is assumed to meet the lower income need. Other housing types like accessory dwelling units can also meet a portion of the lower income RHNA, but when we're looking at vacant land for the lower income RHNA, the site must allow 20 units per acre in order for us to count it towards the lower income RHNA. Now I'm going to hand it over to Jennifer to talk about the residential sites inventory.
All right, thank you, Chelsea. Chair Parks, members of the board, and Mr. Powers, good afternoon, and thank you for the opportunity to present to you. My name is Jennifer Butler, and I'm the project planner for the county's housing element update. Today, I will be reviewing the county's draft plan to meet housing targets and provide a brief overview of the program's plan to facilitate housing production in the unincorporated areas of the county for the next 8 years. State law requires that jurisdictions identify sites in their housing element that can be developed for households of all income levels. Chapter 4 of the county's draft housing element, which is Exhibit 1 of your board packet, goes into the various assumptions that staff has made in order to identify residential development sites in the lower, moderate, and above moderate income categories. Furthermore, Appendix A lists out all the individual parcels associated with the analysis in Chapter 4, utilizing a table that was provided by HCD. Please note that the sites identified in Chapter 4 in Appendix A does not reflect all the developable sites in the county. The recently adopted general plan has identified capacity to build approximately 28,000 units in the unincorporated areas. The inventory identified for housing element purposes identifies just enough land to meet the RHNA targets, and therefore does not include a complete inventory of all developable sites. Although state housing element law requires that jurisdictions identify sites available for housing at all income levels, a higher level of analysis is required of sites identified for lower income housing. The proposed draft housing element plans on meeting the county's lower income housing targets in the following 3 ways. First, the utilization of residential high density sites zoned at a minimum density of 20 dwelling units per acre, and by projecting future development activity based on historic permitting trends for farm worker and accessory dwelling units, and by counting projects that have received land use entitlements but are not yet built. I will now go into discussing further details about each of these categories. As Chelsea mentioned earlier, density can be a critical factor in the development of affordable housing, especially in places like Ventura where land cost is high. Higher density development can lower per unit land costs. In 2011, the county processed an ordinance amendment that created a residential high density, or RHD zone, that accommodates multifamily housing at a minimum of 20 dwelling units per acre. A concurrent rezoning of 7 parcels to RHD zone was also approved. The site inventory presented to you today counts 6 of the 7 RHD zone sites in the lower income inventory, and one of the sites that is located in Peru has been placed in the above moderate income category due to various site constraints that will likely make the cost of construction high. These sites were also processed to allow multifamily housing as a use by right, meaning they require only a ministerial zoning clearance pursuant to the standards outlined in the county zoning code. Policies that apply to discretionary permits do not apply to RHD zone sites because they are ministerial. This site here shows site number 1, which is one of the sites zoned RHD, and it is located in the El Rio community. The site is zoned to accommodate a minimum of 16 units. Site number 2 consists of 3 adjacent RHD zone parcels, which in total makes up 8.1 acres and can accommodate at least 163 units. These sites are also located in the El Rio community and is located just northwest of site number 1. Sites 1 and 2 in El Rio have sewer services provided through the County Service Area 34, and water is currently provided by Cloverdale Mutual Water Company, which is a small independent water purveyor. Staff recently found that Cloverdale Mutual Water Company is in the process of merging with Vineyard Avenue Acres Mutual Water, which is another independent water purveyor, and they are utilizing Prop 1 funding from the State Water Resource Control Board in developing a feasibility analysis that would connect the 2 systems together and provide additional water capacity. Site number 3 consists of 2 adjacent RHD zone parcels in the community of Santa Susana, which is anticipated to result in at least 41 units. The water for these sites is provided by County Waterworks District Number 8, and sewer service is provided by the Simi Valley Sanitation Service Area. These 2 sites are located in the Habitat Connectivity Overlay and the Critical Wildlife Passage Areas overlay zones. But these overlays do not limit development on the site zone RHD. However, they will be specific standards related to outdoor lighting and planting of invasive plants that will not be allowed. So HCD allows for jurisdictions to project development potential based on historic permitting activity. The county utilizes this method for farmworker and accessory dwelling units, or as we call them, ADUs. Since 2014, the county has permitted approximately 1 farmworker dwelling unit per year. So in the draft housing element inventory, we are projecting that a total of 8 farmworker dwelling units be permitted throughout the 8-year planning period. This past fall, HCD released a methodology to assume ADU projections and affordability. The guidance provided to jurisdictions was to assume that production of ADUs will increase 5-fold in the future compared to the ADU permitting activity that occurred between 2014 and 17. Since the county has permitted an average of 23.5 ADUs per year between 2014 and 17, the county can assume an average of 117 ADUs to be permitted annually, or a total of 936 ADUs throughout the 8-year planning period. Furthermore, HCD partnered with the Southern California Association of Governments, or SCAG, to develop an affordability assumption for ADUs. Based on this report, Ventura County can assume 46% of the total ADUs being projected to be affordable to lower income households. Hence, the county can count a total of 430 units towards the lower income inventory. The number of projected ADU development is significant. However, ADUs have been very popular in the county, and ADU permits have doubled since new ADU laws passed in 2018. Staff is hopeful that the implementation of the new ADU laws that passed in 2020, coupled with the proposed ADU programs in the draft housing element, will lead to more ADU production in the county. Furthermore, staff conducted an ADU survey this past spring that confirmed that ADUs are an important source of affordable housing in the county. The results of this survey shows that 45% of the respondents don't even charge rent for their ADUs. In fact, many of these units are being occupied by family members. And those that do charge rent, many of them are being rented at costs affordable to lower income households. The detailed results of the survey is available in Appendix C of the draft housing element. Now I will be going over the approved residential projects that we are counting in our housing element inventory. Your board recently adopted a 360 unit farm worker housing complex project called Somas Ranch. Although 360 units were approved, staff is proposing to count the first 2 phases of the project for housing element inventory purposes, which will result in 200 units. If all 360 units end up being built in the planning period, we can count all 360. However, staff wanted to propose a conservative estimate since the project was being built in multiple phases. Cal State University Channel Island has planned for a second phase of residential development in their University Glen community. Phase 2 entails a total of 600 units, of which 170 units will be dedicated for income-restricted senior housing and have been allocated in the lower income inventory. Rancho Sierra is a 50-unit supportive housing for seniors who are experiencing mental illness. This project is located on county property on Lewis Road next to Casa Pacifica. This project was approved ministerially in November 2020. No public hearing was required since the project met the requirements of AB 2162, a recent law that went into effect on January 2019, which allows for supportive housing that meets specific requirements to be permitted by right in zones where multifamily and mixed-use development is permitted. The Ryder subdivision project was a subdivision that was approved in 2008 along with 2 other subdivision maps. The project included a mandatory inclusionary housing requirement where 5 units were designated to be affordable to lower income households. This inclusionary requirement was imposed due to the site's location within the former redevelopment agency boundary. The property owner is currently in negotiation with Wheeler Homes, who wants to build these units. This table here provides a summary of all the lower income site capacity assumptions. Based on the assumptions we just reviewed, the project capacity is 1,084 units for lower income units only. This provides a surplus of 542 units in this income category. This slide shows the overall residential capacity for all income categories. As you can see, the county's inventory is exceeding the draft RHNA targets at each of these income categories. HCD recommends a 20% surplus for the overall RHNA housing targets. The draft housing element before you is proposing a surplus of approximately 96%. Having a surplus of units in each income category is important because of new law, commonly referred to as a no net loss requirement. As Chelsea had explained earlier, this new law mandates that each jurisdiction needs to maintain adequate site inventory capacity to accommodate RHNA during the entire 8-year planning period. A jurisdiction must identify additional sites if land use decisions or development results in a shortfall of sufficient sites to accommodate the remaining housing targets at each income category. One way that this could potentially play out would be if one of our RHD zone sites were to be developed, but due to rising land costs, the units constructed were rented out or sold at prices too high for lower income households. In this case, we'd have to assess whether we have sufficient buffer in our inventory to make up for the market rate units that were built instead of the projected lower income units. If there is not enough remaining buffer, we would be forced to identify new sites to accommodate lower income housing. That is why our proposed buffer is high. A following slides will be an overview of the proposed programs for the county's housing element. These are draft programs, and there is still time to modify this list before we submit the draft to HCD. As Chelsea mentioned earlier, the draft housing element is reflective of the new general plan format that consists of 5 goals with 32 policies that support those goals. As your board may recall from the general plan update hearings, there were cross-cutting themes highlighted throughout the general plan elements associated with healthy communities and environmental justice. These cross-cutting themes are reflected in the policies and programs in the proposed draft housing element. In the next few slides, I'll be briefly going over a few of the select programs from the 21 implementation programs that are proposed. However, staff is available to answer any further questions that your board may have on any of the proposed programs. For discussion purposes, staff organized the 21 programs into 3 categories: ongoing, continued, and new. Ongoing programs are those that are being brought forward from the currently adopted housing element. These include activities such as programs spearheaded by the CEO's Community Development Division that provide financial assistance for housing construction and rehabilitation through funding provided by the state and federal government, and staffing for the Mobile Home Park Rent Review Board to administer the county's Mobile Home Park Rent Control Ordinance. Also, the county's Fair Housing Program. Even though incorporating fair housing as a new state requirement for housing elements, it is not a new concept, and it is being proposed to be carried over to this new housing element. Continued programs are those that have been previously approved and certified by HCD, but were not completed and are now being proposed to be carried over in this update. Both the Inclusionary Housing Ordinance and the Housing Impact Mitigation Fee programs were subsequently put on hold due to the prioritization of other housing-related programs, including zoning ordinance amendments required to address new state housing laws. The Inclusionary Housing Ordinance program was put on hold due to pending litigation regarding inclusionary housing requirements in the California Supreme Court. In September 2017, the state legislature adopted AB 1505, allowing local jurisdictions to adopt inclusionary housing ordinances. Both programs are now being proposed to be carried over as Program K, where they would be brought to your board for direction and consideration prior to any work commencing. Many of the new programs are state mandated, as you can see where we placed a new state law in red next to the programs. Some of the new programs were developed after researching best practices from other jurisdictions, after receiving input from the public and stakeholders, as well as consulting with the county's Community Development Division staff on programs already approved by your board through the Regional Consolidated Plan. For example, Program E, the Farmworker Housing Study, is a new program being proposed as a result of meeting with the House Farmworker Stakeholder Group. The last county farmworker housing study was conducted in 2002. The local agricultural industry has evolved, and with it, the needs of the farmworkers and their families have changed. In meeting with the House Farmworkers, a local nonprofit advocacy group, the need for a county-wide comprehensive assessment of the local farmworker population was expressed. The study would include a farmworker population count, an analysis of both the barriers and potential solutions to providing more farmworker housing. And if approved, county staff would take on a leadership role, coordinating with other jurisdictions and advocacy groups to seek funding for a comprehensive study. Program G, the RENA transfer program, is something that was identified when researching best practices from other county jurisdictions. State law states that if an annexation of unincorporated land to city occurs, a portion of the county's RENA allocation may be transferred to the city. This program is proposing to bring forward to the Board of Supervisors' consideration options for working with cities on a RENA transfer program. The County of Los Angeles and the County of Santa Barbara have already implemented transfer programs as part of their annexation process. And as mentioned earlier, there are 2 new programs being proposed to incentivize ADUs. The first is the ADU Homeowner Tool Program, which proposes to develop web-based educational tools for property owners in both English and Spanish, and the second is the Modular ADUs and Garage Conversion Building Plan programs, which piggybacks on work to be completed by VCOG and funded through a SCAG grant called the Regional Early Action Planning Grant. Specifically, VCOG intends to launch a regional ADU program that will provide free design plans for ADU garage conversions and less expensive modular ADUs to assist member jurisdictions in meeting their housing element requirements. The draft housing element proposes a few new programs that furthers the goal of affirmatively furthering fair housing. The county's Community Development Division has administered many housing programs utilizing federal and state grants to further fair housing activities, such as the administration of housing choice vouchers to area housing authorities, and providing down payment assistance to first-time homebuyers. These programs have been available in the past through the Consolidated Plan, but now they are being proposed to be highlighted in the draft housing element as well. This slide outlines the various ways in which staff has reached out to the community to gather input on the draft housing element. Due to the COVID-19 pandemic, staff was unable to meet for in-person community meetings. However, we utilize a Zoom platform and offer simultaneous Spanish translations at our virtual public meetings that were held in August 2020 and January 2021. Additionally, we publicized the Housing Element Survey and virtual workshops on the county's social media platforms, including Nextdoor, Twitter, and Facebook. In October of 2020, Planning Division staff sent out notifications to organizations including MyCop, CAUSE, CEDC, House Farm Workers, LULAC, and Area Agency on Aging to alert them that the Planning Division staff was available to attend meetings to present on the housing element update and receive feedback from their members. The draft housing element includes details on public engagements that were held through January 2021, but it does not include comments received from the Q&A session that was held 2 weeks ago. Details on that meeting will be added to the draft housing element before it is submitted to HCD for review. For your board's information, this slide shows a summary of the public input that was received at the Q&A session. Staff will be researching these further and integrating revisions where needed prior to HCD submittal. One of the comments that was received, as referenced in Exhibit 4 of your board letter packet, is from Ellen Brokaw, representing the House Farm Workers Group. She had requested a revision to the proposed language for Program E, which is the Farm Worker Housing Study Program. The revision here that is shown on this slide provides a more detail on what the Farm Worker Study will analyze and incorporates coordination with the agricultural community, which staff believes makes sense. Okay, now we are here today. This is the project timeline. We are here today to receive comments from the public and your board on the county's draft housing element. Once the draft housing element is approved by your board, it will be submitted to HCD for a 60-day review comment period. Submittal of the draft document to HCD is the first step in the review process and does not limit further review or public comment on the draft document. Once staff updates the draft housing element with comments provided by HCD, the draft housing element will be presented to the Planning Commission and then the final version to your board for adoption in September 2021. In conclusion, staff recommends that your board approve the actions listed on this slide. And staff is available to take any questions that your board may have.
Thank you. Thank you for the really clear presentation. Appreciate the PowerPoint and getting it in advance. And also, I really like that we did get comments from the public and made changes as a result of it. And as was mentioned, made it even better. So with that, I would like to go to the public comments that we do have some more of, unless any supervisor wants to ask a question before we go there. And not seeing any, let's go ahead then. I see we have 5 speakers, and so I'll start with them. First, I have Karen Flock, followed by Jennifer Nora Colley and Chelsea Payne, and we'd like to give you 2 minutes. And go ahead, Ms. Flock.
Thank you. Good afternoon, Chair Parks, members of the board, and staff. My comments regarding the draft housing element are based on my experience developing and advocating for affordable housing and farm worker housing. I'm a board member of House Farm Workers, and I work for the Housing Authority of the City of San Buenaventura as a developer of affordable housing. First, I want to thank you for your support of the Somas Ranch Farm Worker Housing Project. That is a significant step forward to addressing the need for farm worker housing. I support the other comments that House Farm Workers has made, and I want to particularly address the program for the farm worker housing study. And thank you, staff, for integrating the comments that we've made, but I do want to urge you to commit the county to leading the study and ensuring that it is funded and completed in a timely manner. So the study will provide important support for affordable housing developers as we pursue funding for affordable housing projects. And it will provide critical information for developers as we design farm worker housing and address the constraints to developing farm worker housing. And I believe it will encourage more developers to develop farm worker housing. I also want to speak to the fair housing objectives. The California tax credit allocation.
Go ahead, you still have 30 seconds.
Okay. And the Department of Housing and Community Development support the development of affordable housing in high opportunity areas, and I appreciate the draft housing element identifies potential affordable housing sites in those areas. Thank you very much.
Thank you very much, Ms. Blacken, for the great work that you do. Let's now go to Jennifer Nora Coley, and she is on phone, I believe, or audio only. Go ahead, Ms. Coley, if you are available.
She is not available.
Okay, thank you. And then we'll go to Chelsea Payne, followed by Ellen Brokaw.
Chelsea spoke earlier.
Okay, good. Then now we will go to Ellen Brokaw, and there she is. Hello.
Hello, Chair Parks, members of the board, Mr. Powers. I was struck by Chelsea's description of the draft as user-friendly. I just want to say that we at House Farm Workers are so appreciative of your user-friendly staff. They have listened to us, thought our comments, and we really appreciate that. So many thanks to Tricia, Dave, Jennifer, others. I want to add my comments in support of the Program E, the Farm Worker Housing Study. The study that we have been modeling our thoughts after, it was done in Monterey, and the significant thing about it is that it resulted in action. It's not a study that just sat on the shelf. Since it was completed, a good many farm worker housing projects have been started or completed in Monterey County and Santa Cruz County, including some very innovative models. So I appreciate the staff bringing forward our modified language, and I ardently appreciate all of you, Board of Supervisors members, for your support of farm workers and the agricultural community in this wonderful county. Thank you.
Thank you. And also thank you and House Farm Workers for their great work that they have done to date and bringing this opportunity for a lot of coalescing of individuals to understand the importance of making sure we can house our farm workers, and then also for the work that you've done for giving out scholarships and also for doing some fundraising too. I know I've asked if we could put the wording on the screen that shows the changes, the modifications that you support. And I'm just interested, I know it's really important for us to have that partnership. And I know as I recall reading it, it put the county in the lead for, pushing for that fundraising. And certainly we have the ability to look for grants and such, but I just want to make sure that we always work in partnership and it's not necessarily one being the leader, but rather working together. So the revised wording that you have there is to have the county or all the organizations take a coordinating role. I guess it would be the county taking a coordinating role to implement, and a countywide survey. Oops, there it disappeared. So there, I just want the board to have the opportunity to see that. So I'll go ahead and call the next speaker, and our staff can work at putting that back up again. So our last speaker, as I understand, is Linda Braunschweiger. So go ahead, Ms. Braunschweiger, you have 2 minutes.
Thank you very much, Madam Chair and board members. I'm Linda Braunschweiger. I'm the Vice Chair of House Farm Workers, and I have over 30 years experience in affordable housing finance. I also wanted to reinforce the staff support recommendation for the House Farm Worker, for the Farm Worker Study. As a lender for affordable housing, it's very difficult to accurately underwrite loans for farm worker housing developments due to the lack of current and accurate information regarding the number of farm workers in Ventura County, the demand for farm labor, and the types of housing needed, whether it's an SRO or bunk housing or family housing. This information has been needed for years, so I recommend that the board commit to lead the study, ensure that it's funded, and that it's completed soon. House Farm Workers is here to help, as you've all heard, and partner with the county. I strongly encourage the board to adopt the submitted language proposed by House Farm Workers. Lastly, I encourage the board to support House Farm Workers language in Chapter 2 and Program O, which encourages the county to commit local funds to supplement state funds to develop farm worker housing. The county has been very supportive of the Housing Trust Fund since its inception and made a huge difference in 2020 with the county's commitment of funding that helped the Housing Trust Fund receive over $4 million in Prop 1 matching funds. And I encourage the county to create a dedicated source of funding, possibly from a mitigation fee program strictly for the Housing Trust Fund. Funding farm worker housing is one of the top priorities of the Housing Trust Fund. Thank you very much.
Thank you. And again, appreciate your work too on such an important aspect of housing in this housing element, and also looking at ways that the county could assist. And then again, looking at those partnerships, and we look at the private-public partnerships that are out there, and how I really feel like we need to do more into getting that private sector involved, because often we have these wonderful nonprofits and county government, but not a lot of, for example, businesses stepping up to assist with the housing costs, and they are expensive. So I would love to be able to see a more robust effort to bring in private sector partners and see what we can do towards getting more funding so we can continue to do the work that we've done. And I know it also with the SOMA's Farm Worker Housing Project that was approved, was it just last week? Hundreds of units, and I know that that is going to be needing a significant amount of funds to put that together. So just looking at where we can to partner also with our private sector. So that's something that I think is an important aspect of this also. Were we able to get the language put onto the screen? It was there for a brief moment. And that was regarding the revised wording on the study that's being requested. There we go. Thank you. Yes, thank you. And certainly that is relative to the study. But that first number one, starting off with take on a coordinating role to seek funding. And that's where I would like to see how we can do a more robust outreach again to the private sector and see who steps up. Does our board have any questions or comments that they would like to ask our staff?
I do.
Yes, I would.
Okay.
Or Supervisor Ramirez, go ahead.
I'll defer to Supervisor Long.
Go ahead, Supervisor Long.
Thank you.
Thank you. Yes, I appreciated the update from staff on this pre our meeting. I do agree with the farm worker housing big time. I think it's so important to our community that we're looking at the needs and assessment. We saw that last week with the SOMAS project. And so I did have a question in regards to this housing element with SOAR. And on your questions and answers slide, you stated the sewer and water connection. And that was one of the items in which we were talking about in that project. So what are we going to do to consider, where does it say, discuss, what are we discussing sewer and water connections? What are your intents on that one?
Hi, Supervisor Long. This is Jennifer. We plan on adding that analysis into our draft housing element before we submit it to HCD.
Okay, so
I understand there is actually one of the new laws, right, that is specific to infrastructure. So I think that is the reason why that's up there. Is that right, staff?
Well, we do assess infrastructure specific to the sites that were identified in the inventory, but we can also include a comprehensive infrastructure assessment or draft as well.
And I think that's important as we're looking at these projects when we're considering, is it a vote of the community or what the new state laws are associated and so forth. So I think that's an important one. So I want to make sure I understood what you were looking at for that. The next item is the tiny home on wheels. Now, are we talking about having county land that you drive a home onto? If you could touch on that, what's the consideration?
Sure. So this specific commenter had requested that she had purchased the land and she wanted to place a tiny home on wheel on that land. And tiny homes are not formally defined by HCD. The term is generally used for any dwelling unit that ranges from 80 to 400 square feet. And the county does allow for tiny homes on a foundation, following building codes with access to water and sewer. But tiny homes on wheels are regulated by the DMV, the Department of Motor Vehicles. And so we have not pursued that specific type of housing. And to my understanding, HCD doesn't recognize tiny homes on wheels as an official dwelling unit.
That's a good concept. We have property owners that will have a trailer where perhaps some of their staff live that are on their property. And so I wanted to understand that as to a situation. Then also, we talked about the homeless in many of our programs, but I had touched on before about veterans housing and our need to ensure that we're housing our veterans, especially the homeless. And so did anyone look in, that is covered within this housing element?
Yes, and actually Christy Madden from the Community Development Division sent me a list of all the efforts that the county has done through the continuum of care to assist veterans with housing. And I just wanted to make a point that all the housing opportunities that we discussed in our presentation today is available to the veterans population, like ADUs, lower income RHD zone sites. But efforts specifically for veterans, there were 35 homeless veterans that were placed in non-congregate motel for shelter. There were 16 homeless veteran households that have been staying in the Project Room Key motels. There have been 37 homeless veterans that have been issued Veteran Affairs Supportive Housing vouchers. And there have been 18 homeless veterans that were staying in transitional housing at Turning Point Foundation. And there were 3 homeless veteran households that have been staying in a motel with funding supported by the United Way of Ventura County, and 9 veterans who were previously working with homeless services providers in the past 6 months.
Thank you for that information. It's really important for our community. We have our Navy base, so many veterans here, and so appreciate that. Now, the projects you stated on that are going to propose for the housing projects, we're not locked into those. So if we had someone come in and say they wanted to do another project, we would review that and see if it was equitable, correct?
Yes.
Okay. And so then another question I had was, as this plan is rolled out, how does that correlate to the general plan? So if we have new state laws and updates, does the housing element require that all those changes have to be analyzed in the general plan, like the EIR? How does that work?
I'm going to defer this one to our planning director, Dave Ward.
I only asked because we did a big EIR with the general plan, so then we pulled this out. How does that correlate back into the EIR for that?
Yes, Chair Parks, Supervisor Long. The housing element, as far as the state laws, so as the legislature takes action on new laws, we have to address those by the date of their applicability. So what we've had over the last couple of years have been in relationship to ADUs is one particular category, and those laws become effective even though our ordinances may still not be updated. So we are currently processing ADU applications today in relationship to that state law so that we're still in compliance, although we have a work plan that includes updating those ordinances. So that's how the state laws are addressed as they are adopted by the legislature, and we have to implement them. The housing element is on the 8-year cycles. So those are often not in alignment with the general plan update because it's the only element of the general plan that has a mandated schedule. So our 2040 general plan, adopted in September of last year and effective in October, did assess what our growth would be over a 20-year time horizon to 2040. And so in that regard, our housing element is inclusive of that growth projection. Although it's only looking at an 8-year time horizon, it's encapsulated in that 20-year time period. So as we do our environmental document now on this draft housing element, we will be relying upon a lot of the analysis contained in the general plan EIR that was certified last fall as part of the baseline information as we analyze the goals, policies, and programs of this new housing element.
Okay, thank you. I appreciate that information because it's a lot to be wrapping your head around when you're talking about all the different environmental impact reports, especially when you're doing housing and where it is and the location and so forth. Thank you.
And I know that there were some other questions that we haven't reached yet that were on your list, including school fees. So if you want to bring that back up, that would be helpful too. And Supervisor Ramirez.
Yes, thank you. I just have some comments, but also want to just review that I was the representative for Ventura County at the SCAG RENA appeals, and I went through almost 50 cities and a couple of counties appeals of the RENA allocation. And it was, I just want to say that what it seems to me what the county is being asked to do in terms of total number of units is very mild compared to what cities, especially in other counties, are being asked to do. It's just, you just think this is really not going to be possible to even plan for, because again, cities and county don't build. You do the planning, you provide the zoning for housing to be built. Clearly we're here because of lack of housing, and we have homeless problem. We have overcrowding, which is really very problematic during this COVID crisis. I wanted to point out, I think it's one of the slides that I'd like to just pay some special attention to, and it's the one on affordability, which is, I think it's about page 8 of the PowerPoint. 2020 affordability categories in Ventura County, yes. And I'd like to just note what this is. It's so overwhelming. I do know of people in my district who are renting a room for more than $846, and sometimes that room has to accommodate a whole family. I do know of people who are on very limited benefits, SSI. SSI is supplemental security income. It's available to people who've worked, let's say, as domestic workers or have been a homemaker and never actually had wages that paid into Social Security or any other retirement. And $846 is just slightly less than their monthly check, which might be $900 or so dollars. So you can see how difficult it is. And I think it's really very sad that a lot of our seniors have only SSI for an income, and what could they possibly afford? So it's just potential tragedy there with people not living in good conditions or not having a roof over their heads. So I really appreciate that we're taking a look at it. I wanted to ask about the low barriers to housing from our planners here. And low barrier, am I correct in thinking this is the housing first model? You don't ask people to become 100% well before they get a roof over their head when they go into, let's say, supportive housing. Could our planners comment on that?
This is Chelsea Payne with the consulting team.
Yes.
Yes, Supervisor Ramirez. So the Low Barrier Navigation Center it is a housing first low barrier shelter that has services tied to it. So it has a lower barrier for entry, and it's trying to get people back into permanent housing. So the new law is to expand where those shelters are allowed around the state.
And I want to just relay that when I was on Oxnard City Council, we did have a number of these programs come and were generally approved by council. It's difficult because sometimes communities don't quite see the benefit of having a navigation center or having a motel turned into supportive housing. But I was always very strong in encouraging my community, our city residents in Oxnard, to support this, because so much better than having people living in substandard housing or on the street itself. And I do really support the comments about farm worker housing. We have, I think everybody who's really thinking about this understands that we have to house our farm workers. I say our farm workers, the people who are feeding us, providing essential work in a manner that is dignified, that supports their families, their children, and really appreciate it. Things have changed so much since I first became a county resident, struggling for farm worker rights in every way. And I'm just really appreciative, especially to hear from people I've known as longtime advocates for that, Karen Flock and Linda Braunschweiger, and of course, Ellen Brokaw. Thank you very much.
Yes, definitely the heroes of the movement. Other supervisors want to chime in?
Yes, this is Bob Huber. Can you hear me?
Please go ahead.
Yes, thank you. I want to thank staff for the thorough report. Time and time again, Ventura County residents and voters have made it clear that maintaining open space and protecting land for agriculture is a high priority. However, I do think it's important to have quality housing to meet our county's needs, including farm worker housing, and ensure that these housing plans are compliant with SOAR and the general plan. Thank you very much.
Thank you, Supervisor Huber. Supervisor Levere, did you want to chime in too?
Yes, thank you, Madam Chair. And I also want to start by thanking staff for this report. It was said by Ms. Brokaw, very user-friendly, and I appreciate that. And I also want to recognize staff because outreach is really a critical part of a housing element. And given COVID, that was much more challenging this past year. And the efforts that all of you took to be in the community virtually, numerous different avenues, YouTube, online Q&A, English and Spanish translation, that was just really impressive. So I thank you for doing that extensive outreach given the challenging circumstances. Several questions and a few comments. We talked about identifying sites for future housing units. And I was curious if we have identified at this time any sites for potential homeless or transitional housing.
Hi, Supervisor Levere. My name is Jennifer Butler, project manager. As part of the housing element, we have identified sites that need to be approved ministerially for emergency shelters, and those are identified in the draft housing element. And they are commercially planned development zones.
CPD, gotcha.
Yeah.
And it was referenced briefly, and I was just curious, what level of environmental review does this element have to go through?
I'll defer that to our planning director, Dave Ward.
There.
Thank you, Mr. Ward.
Thank you. Chair Park, Supervisor Levere. The environmental review is something that we'll be working with. Chelsea and her firm are on contract to help provide the environmental review. At this point, we are assuming that this will be on a path of probably a mitigated negative declaration or negative declaration, but we need to complete today's hearing to know whether we have the full scope of our housing element, including all the programs, and that's what we'll be evaluating in the EIR. And that is our next step that we'll be doing concurrently while the review by HCD occurs. So that will be our scope of work and our milestones during the spring months.
I appreciate that, Mr. Ward. And then a last question. I see 21 implementation programs and they're all great. I think it's a really comprehensive list. And I was just curious about prioritization, how we're going to prioritize these 21 programs. Is that something we're going to talk about when you bring your work plan back?
The housing element does identify in the programs what the timeframes are over the 8-year period. So this is in the element that will be approved by your board. And since that approval date doesn't happen until October, the range of those programs aren't articulated in the work plan that I'm preparing to bring back to your board, except for the item related to the farm worker housing study. That is an item in the first 2 years of the housing element, starting in 2022. So we did fold that in as an overlap into the work plan. So you would see that one shown, as well as regular staffing resources that we have, including what Jennifer Butler and Owen work on, which are addressing some of the state laws. That's a continuing, ongoing effort in the division.
Okay, I appreciate that. And then just some general comments. I absolutely support the program. that support the development of ADUs. I think that's going to be a critical feature of us attempting to address the affordability crisis, which my comments have mentioned and which is clear in the element. Program S, which is the waiver of the Development Review Committee fees for 100% affordable projects. They're calling, or the report calls for this to be implemented in the summer of 2022. And I was curious if it would be possible to include this in the mid-year amendment, the annual mid-year amendment we do to the service rates and fees. And if there was a reason it wasn't included then.
Hello, we can easily include that as part of the fee update.
Yeah, I think that would be important because I think that's one of the the programs which I really support, focusing on 100% affordable housing. As some of my colleagues said, I absolutely support the comments and the advocacy of house farm workers. I think program E, the farm worker housing study, is just so important. And I appreciate staff putting this in the work plan this year and really taking the lead on that effort. It's been 20 years since we've done one of these studies, and things have just changed so much. And I know there's a lot of support in the community for collaborating and working towards solutions to address farm worker housing. And one comment that kind of ties in program E and program D, and that really has to do with focusing on constraints to the development of affordable housing and farm worker housing. And I really hope that we can take a hard look at maybe whether it's internal policies and regulations that maybe we can improve, if it's infrastructure improvements. And one of the things that stood out to me at the Somas Ranch hearing last week was the issues with LAFCO and how that kind of inhibited the connections of utilities with that project. And maybe we could bring LAFCO into this discussion and figure out ways that we can improve those policies and regulations. I just think it's really important that as we go through this process, that we really take a hard look at some of our internal policies and regulations and things that we can do to make it easier to develop farm worker housing, affordable housing. Just as is shown on that slide, the affordability situation in this county is scary, and we really need to take just a close look at ways that we can address that crisis. In my mind, it truly is a crisis. But I know that staff recognizes that, and I appreciate that it's a critical feature of this element. And so thank you for that.
Thank you, Supervisor Levere. I know that one of the requirements of SOAR is that if you are going to build outside the urban boundary limit of a city, you have to show that there's nowhere else within the city. And that will allow you, if you can show that there's nowhere else inside the city for affordable housing, then we can consider having housing in the unincorporated area without the vote of the people. And so I'm hopeful in looking at the survey that is being asked of us for where we might be able to put affordable housing, that we really collaborate with our cities. Because if a city gets to that point where, there is a affordable housing project and there isn't a place in their city, that's when we can start looking at the unincorporated area and extending the sewer system and all. So I think that's an important feature of working with our cities. And then just a comment, I know the state has gotten incredibly aggressive pushing the cities to develop more housing, and and we're also, of course, in a situation of drought where there isn't enough water. We intentionally don't connect sewer lines and water lines into the unincorporated county because the whole intent of the guidelines for orderly development of our general plan is to build in the cities. So we have that farmland to develop, and we don't take out farmland to put housing. It defeats the purpose. My frustration among the many requirements from Sacramento was just in that last slide, for example. Sacramento's telling the cities to build high-income housing. I don't think that's anything that government should be pushing at all. That's not something that's important to the government. Government should be more involved in, like we did with the farm worker housing, 100% affordable housing unit. I mean, that's something, certainly that government should support. But I just think it's ridiculous that we're being told to rezone land for high income units also. And that's just an example of some of the things that aren't quite right with the push coming from Sacramento. So I could go on, but I won't. I'll save you all. And with that, do we have any other supervisors who would like to comment, or we could also
Yes, I do.
Close the public hearing at this time and entertain a motion?
I do have another question, Madam Chair, and that's regards you had talked about the school fees and school impact fees when we're building a new project. And I would like to make sure that our staff looks at that, but I do have great concern in taking those fees away from our school districts. We have small school districts in, just an example is Briggs School District, in how that helps them. One-time fees like these housing developments can really help the school district to prepare for our students. And so I wouldn't like to remove those fees. I'd like to make sure that we're really, they're needed in our community. So I just have a problem with pulling those fees if we have to. So I hope that makes sense. I just think that those are valuable to our school district and we should really not remove them, but yeah.
And we saw an example of that too last week, didn't we? With the fees being able to go to Soma School, who might be able to, they may be able to put in some portables, but that it is a really important aspect because these units are going to generate students.
Right. And you have Santa Rosa, a school that's out in Santa Rosa Valley, that's 100 years old. And pipes need to be redone and certain things. So I value that being on a past school board.
Yeah. Soma School is also over 100 years old.
Exactly. So I'm just cautious of that. But I do appreciate everyone's feedback. And I would like to, I don't know when you're going to, the next time we're going to see this, but I want to see what items you add based on the letters that we received on Monday. I know that was quick to do it, but I'd like to see what those changes are that you'd like to incorporate. Thank you.
Also appreciate the comments from Chris Stevens too. I know that we got a letter from him. Supervisor Ramirez, you wanted to comment?
I just wanted to add in the last few months, and especially in January, I was very involved with the RENA process, as I mentioned, and had an opportunity to see the work of planners, both from Southern California Association of Government and all of the cities, so many cities and other counties in the Southern California region. And I just want to say, including to our two presenters today, and as well as our staff, it's just amazing work to come up with a product that we can understand. The law's changing, it's complicated, financing is terribly complicated, and putting this all together, my hat's off to you all. Thank you.
Yes, indeed. Thank you. Does staff have anything else they want to impart before we go ahead and have a motion?
No, not at this time. Thank you.
Okay, thank you, Jennifer. And with that then, do we have a motion to close the public hearing, and we can at this time have a motion to receive the presentation? And you received our comments, I think, already.
Since you've closed the hearing, I will motion to receive and file.
We have a motion to receive the presentation, and you've received our comments. Do we have a second to that motion?
Huber, second the motion.
Thank you, Supervisor Huber. With that, could we please have the roll call?
So the motion is to receive and file and to direct staff to forward the housing element to California.
Yes.
Okay.
Thank you.
Thank you for the clarification, Lori.
Thank you. Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes. And I think that's our last item on the agenda. Yes?
Yes.
And then I will if I had my gavel, I would go ahead and adjourn the meeting. So I'll do it on my table.
Bye.
We're adjourned. Thank you.
Thank you very much.